my dear friends. A very good evening to all of you. Today in this session, we are not just going to discuss the PYQ of FMGE from 2020 to 2024, but we will also discuss the complete topic, and we will also try to understand what are the other questions which came from the same topic, okay, either in NEET, INICT or in FMGE. So let's start with the first question without wasting time. The first is, which is not constrained by time or existing resources, and there is a lot of confusion on this topic. But do remember, my friend, vision is the one which is not having time limitation. Goal is limited by time. Like, let's say my vision is that I want to see all roads and railway tracks of India with fruit tree on both sides on it, like that's my vision. So there is no time limit for it. But goal will be that for that I need to be economically free, not dependent on any job in next 3 years, like that. That will be the goal. So vision is not constrained by time, being written clearly in PARC. All of the following are principles of primary healthcare except. So I hope you can identify it and give me the correct answer. Community participation is a pillar, and in INICT they have asked that what does it mean? Does it mean you are implementing your idea with help of community, or does it mean that you are implementing community idea by taking community feedback or by involving community in planning and execution? Implementing community idea by involving community in planning. So the planning and execution is also done by community. Execution means implementation, and idea should also come from community. That is community participation. Appropriate facility is not a primary healthcare principle. I hope you know that is not facility, that is appropriate technology. Not facility, but technology. And it is appropriate, not adequate. So appropriate technology is the pillar. And in the appropriate technology, I hope you all know WHO ORS and Sakir tape are two example, very good example, which come under it. Appropriate technology simply means those technology which are low cost and can easily be understood and implemented by rural people. Then the third is intersectoral coordination, and fourth is equitable distribution. It means giving more to those who need more. And intersectoral coordination means, let's say you want to improve Anganwadi condition. So Anganwadi come under ICDS program, Integrated Child Development Services program. And you are a medical officer in charge at PHC. And PHC come under Ministry of Health and Family Welfare. This Anganwadi, initially it used to come under Ministry of Women and Child Development. Now they have included Anganwadi along with PM Poshan in Ministry of Education. So you can see there are two ministry, Ministry of Education and Ministry of Health Family Welfare, which are interacting together. So because two are interacting, that is intersectoral coordination. So do remember these four pillars with their example. Long-term changes sequel in disease are seen in. When they say long-term sequel, that is secular trend of disease. I should have asked it from you, but this is a very frequently repeated question in all the exam. Secular trend, very good example is cardiovascular disease. And do remember, all the trend are represented by line diagram. So whenever they ask a question on trend, answer will be line diagram. Like you can see in the world from 1950 till 2020, cardiovascular disease, diabetes and all are increasing constantly over a long period of time. So that is example of secular trend. Next is a 5-year-old child came to OPD with fever, rash body. Rashes are on axilla and flexor surface. And a kakhe, and you understand the mainly it is in the central part of the body, not in the palm and sole. So if it is central part, this means it is centripetal. And do remember, they have asked it again and again, chicken pox rash are centripetal or centrifugal. So very easy to remember, CP for chicken pox, CP for centripetal. So these are centripetal rash of chicken pox. Anyway, the second hint that was given was blister are seen in different stage and non-uniform. So different stage and non-uniform, it means they are talking about pleomorphic rash, which is again of chicken pox. One more thing, remember, many times they give child face image and they ask, is it measles or chicken pox? So chicken pox look like dewdrops on rose petal. ऐसा लगता है जैसे गुलाब की पंखड़ियों पर ओस की बूंदें हो. That means it comes out from the skin surface like dewdrops or chicken bick. That's why they call it chicken pox. So when it is chicken pox rash, it is coming out. When it is measles rash, it is in the skin surface. And do remember, measles rash start from back of hairline, back of ear, and then go to face and body. है ना? तो कान के पीछे से शुरू होंगे. किसके पीछे से? कान के पीछे से, and then go to face and body. So if it is that pattern, it is definitely measles. Plus one more difference is chicken pox and rubella. These two rashes are dry fever with rash. There is no cough, cold, coryza, and conjunctivitis. But when it comes to measles, measles will have cough, cold, coryza, conjunctivitis. That means secretion will be coming out from nose, mouth, everywhere. So if you found an image of child with secretion coming out and rashes in the skin surface, it's definitely measles. But if rashes coming out and no secretion, that can be chicken pox, that can be rubella. But mostly when they give image of face, that is chicken pox. Rubella mostly occur in the body, and in local language they call rubella as Phool Kumari. Very light type of rashes occur with very less complication. One more thing you should remember is, in rubella, the pathognomic thing is Forchheimer spot. This Forchheimer spot occur on soft palate. These are pink dot on soft palate. So if you found an image of soft palate with pink dot, they are talking about rubella. And of course, we all should always remember that congenital rubella syndrome will have three things: sensory neural hearing loss, congenital cataract, and patent ductus arteriosus. But in less than 12-week period of gestation, if mother came, then congenital rubella syndrome with these three things occur. If mother came between 12 to 16-week period of gestation, then only sensory neural deafness will occur. No other complication, only sensory neural deafness. And if mother is coming, let's say after 16 week, then even sensory neural deafness will not occur, and they will trick you with this question that mother is coming is at 18 week or something like that. So if mother is coming at 16 week, after 16 week with rubella, then you just have to give reassurance, because now no more complication will occur. So let's come to this next question. A man came for checkup after his father had a cerebrovascular accident due to hypertension. Which type of prevention it is? In the same question, if they would have came for physiotherapy, physiotherapy is tertiary. But when they ask about checkup, checkup means a screening test. It means early diagnosis of second attack, or it means we are checking whether the antihypertensive medicine given to the patient is adequate or not. And early diagnosis and treatment comes under secondary. So do remember, whenever they say checkup in health fair, checkup to even a 10-year child or a healthy adult, all checkup means they are doing a screening test, and all screening tests are example of secondary level of prevention. They can also give you an image of a patient whose foot care is being done for, let's say, filariasis, elephant, in which of course hathi paw elephantiasis occurs, so foot care is needed, or leprosy patient foot care, or diabetic patient foot care. Whenever they give image of foot care, this is, we are doing the foot care to limit the disability. And this disability limitation also come under tertiary prevention. So all of this will be tertiary. Mid-year population is taken on which time? It is taken on 1st of July, not 7th of July. And recently also they have asked this question on crude death rate. Crude death rate means whatever death occur in a year, total death in a year, and we divide it by mid-year population on 1st of July. Because before July there is 6 months, and then after July 6 months, so it is mid-year is 1st July. Least iron content is present in which of the following? Really sorry for that. The least iron content out of these four is in milk. And it is written in PARC also, milk has very less iron content as compared to bean, spinach, or liver also. Now, milk also is deficient in vitamin K. That's why we give vitamin K injection just after delivery. Now, which vitamin K is given? K1 is given or K3 is given? That's my question to all of you. So answer is K1 is given, and it is 0.5 ml. It is given intramuscularly in the anterolateral aspect of thigh as soon as the child is born to prevent bleeding disorder. Okay. Next question is, a nurse spilled blood on floor. What can be used to disinfect it? Out of these four options, the correct answer is sodium hypochlorite. Later on, I will teach you with image the WHO guideline how to manage blood spill, and I will show you the image stages how to manage blood spill. In those, it is being written in the WHO guideline that first we should wipe with cotton or whatever is the thing. After wiping with cotton, we have to put sodium hypochlorite. Now, in the WHO guideline, they said sodium hypochlorite should be 0.5%. But in Indian guideline, they specifically write 1% sodium hypochlorite. So this is being put after wiping with cotton or something. Then we put the disinfectant. Then in 2020, they gave this weird image. This is the image of ISI logo, which you can see on silk sari or gold jewelry. Manak Path Padarsak, Indian Standard logo is there. Sorry. This is the logo of Bureau of Indian Standard. That's why that's what I was saying. I was just ticking it wrong. Very sorry for that. Bureau of Indian Standard BIS. This is the logo you will see on, as I said, silk sari and gold jewelry. Delphi technique. What is that? Delphi technique means, let's say you want to select two doctors. Out of two surgeons, you have to select one. And both are asking you for a salary of 3 lakh starting. So how will you select the doctor? First method is you will take feedback from the hospital where they already worked. So feedback of group of people you will take. So this will be Delphi method in which we take group feedback. Second method of selecting people is we will check time taken to do specific work. And time taken to do specific work is written as work sampling. Let's say you want to compare two doctors and one surgeon is doing surgery in hernia repair in 1 hour, second surgeon is doing hernia repair in 15 minutes. So work sampling say choose the one who do the repair in 15 minutes. But it might not be the correct method. Maybe the surgeon who is connecting it in 15 minutes, the hernia repair, maybe he is connecting wrong wire together. And now whenever the patient cough, he had an erection. And जब खांस रहा है तो खड़ा हो जा रहा है. So it can be a wrong surgery which can be done in 15 minutes also. We should not rely completely on work sampling, but if they ask this question, time taken and we are comparing based on time taken, answer is work sampling. The third question they can ask is that some doctors are also doing extracurricular work. So based on extracurricular work, if you are selecting doctors, that means what is extracurricular work which doctor will do? And they will not do dancing or something. They might be involved in counseling or marketing of the hospital and all. So based on extracurricular work you are choosing, it means you are choosing that doctor who is taking the same cost and more effective. And whenever we compare cost effectiveness of two person or program, we call it system analysis. So when you choose based on extracurricular work or when you choose based on cost effectiveness, we call it system analysis. So all these three has been asked in MCI. Do remember group opinion Delphi, time taken work sampling, extracurricular is system analysis. Now in a train accident, there were 74 dead, 64 were severely injured, 20 moderately injured. Color coding in triage, highest to lowest. So if they ask highest to lowest, of course we all know it's red, yellow, green, black. Again and again they ask this question. Let me ask you this question. Where will you put the relatively stable patient? Relatively stable will be red, yellow, green or black. Kindly give me your reply. Very good. Many of you are giving reply already. Piyush Thakur, Ajay Verma, Vaibhav Chaurasia, Zakir Malik, Brown Traveler. Thank you for replying. Which is relatively stable? Red, yellow, green, black. Of course, the correct sequence is D, so the answer is D. Muhammad Asif Khan is given the answer first out of you all, and he is correct. Relatively stable is yellow. Green will be completely stable. That's why we call green as ambulatory, because they cannot run like ambulance, but they can be shifted from one place to another on wheelchair and all. So that's why they are ambulatory. And of course, the highest priority is of red. And they can ask this question, I hope you all know also, black is for moribund patient or dead patient. Least priority. Okay, so do remember this part. Now, which statistical diagram is shown here? Can you identify it? A student usually confuse between multiple bar diagram and histogram. This is the image of a histogram. It would be an image of multiple diagram will have gap again and again, but those gaps will be at fixed interval of time. And let's say gap after every 2. This will be multiple bar diagram. But if there is only one gap, it might be indicating 0 case there. So it is a histogram. Anyway, they have written frequency and age. And as we all know, histogram is used for quantitative data, measurable data. So this is histogram, this is multiple bar diagram. They can ask you this question, that failure of health system can be represented by which of the following diagram. So when they are talking about failure of health system, the best diagram which can represent is known as Ishikawa, not ISK, Ishikawa or fishbone diagram. A recent question has came from it, and I hope this is a new information for some of you. Ishikawa fishbone will represent the failure like this. Let's say I am talking about failure of Indian health system, and this question has been come, how much GDP is being required to be given on health? So the GDP according to WHO guideline, maximum GDP is allowed. But in India, the guideline and expectation is we will give 2.5% GDP on health. But this is the expectation. In reality, we only are giving 1% GDP. So this is one reason for failure. The second reason of failure is less rural area hospital, PSC, CSC and all. Third reason of failure is they are not giving permanent job. They are only giving contractual job to doctors nowadays. That's why there are very less doctor in even good hospital. And fourth reason is of course that there is less doctor in rural area, and they are less there because of the less salary and contractual job. So these all can lead to failure of health system. This type of diagram, you can see it is looking like bone of fish. This is fish bone or Ishikawa diagram. Failure of health system is responsible for this too. Now let's come to silicosis. I hope you all must be knowing silicosis is the most common respiratory occupational lung disease. So it is most common pneumoconiosis. And in silicosis, TB screening should be done annually. This is definitely correct. If silicosis is there, it will damage the parenchyma, and now TB bacteria can easily occur and cause TB. So that's why TB patients should be annually screened for silicosis. The rest all are not true, but this is true. Now, very good. A factory worker had a history of frequent exposure to groundnut. Whenever they say groundnut, they are talking about Aspergillus flavus fungus. And this is a green color fungus which not only occur on groundnut but also on maize. So groundnut and maize with Aspergillus flavus, this will release the toxin aflatoxin, and aflatoxin will lead to hepatocellular carcinoma of liver. I hope you all know ergot toxin is released by the fungus Claviceps purpurea, and it leads to cyanosis or necrosis of finger. Anyway, we all know that ergotamine group of drug is used to treat migraine. So how they treat migraine? In migraine, the pain is due to vasodilatation. Ergotoxin causes vasoconstriction, so the pain is relieved. So the same vasoconstriction is occurring here, causing cyanosis, necrosis of finger and toes. Now, if they ask sanguarine, S for sanguarine, S is for sleeping. And when you sleep, there is dropping of eyelid. So sanguarine is talking about epidemic dropsy. This epidemic dropsy will present with bilateral pitting edema on leg. And because there is dropsy, so pitting edema also means dropping inside. And this is due to eating mustard oil contaminated with seeds of Argemone mexicana. So if you found history of mustard oil, pitting edema, poison is sanguarine, S for sleeping and dropsy, and then pitting inside. P for pyrazolidine, P also stands for pate. So in pyrazolidine, patient have ascites. I also have pate coming out, but it's not due to pyrazolidine, of course. So pate is a Hindi word which means abdomen. Abdomen will be swollen. Pyrazolidine lead to endemic ascites. Ascites, the pate or abdomen will be swelling. So there is a lot of confusion which occur between sanguarine and pyrazolidine. I hope you will not be confused anymore. When they talk about ascites, pate, it is pyrazolidine, and this is due to eating crotolaria with seeds of Panicum miliare. They call crotolaria junjunia, because in tribal and rural areas, this Crotalaria plant grows and it has big kernel, small seed. So when air blows now, it produces sound of jun 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 jun. That's why they call it junjunia. And this lead to eating this plant with Panicum miliare, Crotalaria with Panicum miliare can cause endemic ascites. So do remember these 4 poison. They ask again one more. Last thing is, of course, neuroletharism. I hope you all know about neuroletharism. It occurs due to eating khesari dal, and the poison they ask, the poison is, of course, BOA, beta oxalyl aminoallyl. And 3 years back in MCI, they asked what is the treatment which you can give. So the treatment is vitamin C. They took that question in NEET 2023 and asked what is the treatment of neuroletharism. So many students of NEET exam, it was a new question for them, but it was actually a PYQ of FMGE which came in NEET. So again and again they took this PYQ also. Do remember the treatment is vitamin C, and it is of course due to eating khesari or dal, and this khesari is mixed with arhar dal. So that caused neuroletharism, and in neuroletharism there is cross leg walking on toe. The patient will be walking cross leg on toe, and this is the hint they will give. So do revise this 5 food adulterant again and again. Every 6 months they ask. I'm expecting one question from this 5 adulteration in this MCI exam also. Now let's come to here, definition of blindness. What is the definition of blindness? It is 3/60 in better eye with available correction. But do remember, it is less than 3/60, not less than or equal to. It is less than 3/60. Let me ask you a very interesting question from here, in which I hope many of you will confuse. I hope you all know the classification of blindness. The classification is very simple to remember. The mnemonic is LESMA. LESMA means choti ma, and small mother, not lesbian mother, but LESMA means choti ma. L stand for low vision, and low vision is less than 6/18. E for economical blindness, and economical blindness is less than 6/60. S for social blindness. Social blindness is less than 3/60. It's always less, not less than or equal. M for manifest blindness, and manifest blindness is less than 1/60. And last A is absolute blindness, not vodka. It simply means batti bujh gayi, gone. Perception of light absent. No perception of light. So now the question which I want to ask from all of you is, patient with visual acuity 3/60 and 6/60, in which category you will put this patient? Option A, will you put it in low vision or economical blindness or social blindness or manifest blindness? Do answer it. And to answer such question, we always have to remember that we look it in better eye with available correction. So Piyush Thakur is already given the answer. Karthik is asking a question, sir, how to remember these number easily? So the way to remember is, social blindness means blindness, and we already know the blindness definition less than 3/60. So this is done. Low vision 6/18 3 times, and economical 6/60 10 times. So you just have to remember 2 number. 6/18, less than 6/18, low vision, less than 6/60 economical. Just remember 2. 6/18, 6/60, less than 6/18 low, less than 6/60 economical. Social you already remember, and this has been asked also. Social means less than 3/60. So then this classification will be remembered. Now what is the answer? Many of you are giving C. Zakir Malik is giving answer A. Prashant is giving answer B, economical. So it means you are confused. First thing you have to identify is which one is better eye. 3/60 means patient can see from 3 meter what normal person can see from 60. So, and of course 3/60 is worse than 6/60. 6/60 is the better, because 6/60 means patient can see from 6 meter what normal person can see from 60. So better is 6/60. You will look at 6/60. Now, less than 6/60 is economical. not 6 by 60. Till 6 by 60, we put the patient in low vision. So the correct answer is low vision, which Dr. Zakir Malik gave. So 6 by 18 till 6 by 16 is low vision. Less than 6 by 60 till 3 by 60 is economical. And less than 3 by 60 till 1 by 60 is social. Okay, so let me ask you one more time, one more question from the classification. If you will clear it, we will move ahead. Patient with visual acuity 3 by 60 and 1 by 60. Now where will you put it? Option are A, same four option: low vision, economical blindness, social blindness, manifest blindness. Where will you put it? The classification and cutoff you can see above. Answer it. Manish said social, Prashant said social, Dr. Pila Shravani said social, Manish said social. Everyone is saying social. So you are again tricked. My dear friend, less than 3 by 60 is social. Less than 3 by 60 is social, not 3 by 60. Till 3 by 60, you can see I have written it here. Till 3 by 60, the patient is having economical blindness. 3 by 60 was in economical. So answer is B. Less than 3 by 60 will be social. Till 3 by 60 is economical. So you saw Piyush Thakur gave the answer correct. Salman Khan, which is in our group, very good. He also gave it correct. So it is a confusing one. You understand? Let's have one last question as a practice. Patient with visual acuity. What should I ask? 6 by 60 and 1 by 60. Where will you put it? 6 by 60, 1 by 60. All the four options are there. So which one is better eye? 6 by 60 is better eye, of course. And where will you put 6 by 60? Till 6 by 60, it is low vision. If it is less than 6 by 60, then economical blindness. I have already asked it, so it was a repeat question actually. Let me give you, Karthik gave it correct. Now, this time you all gave it correct. Let me ask you one last. Visual acuity is, now what should I ask? 6 by 36 and 6 by 60. Where will you put it? 6 by 60 and 6 by 36. So which one is better eye? Better eye is 6 by 36. Because 6 by 66 means what patient can see from 6, normal person can see from 36. And low vision is less than 6 by 18 till 6 by 60. So 6 by 36 will come in between that. Therefore, again the answer will be low vision. Second time also this answer will also be low vision. Okay, very good. Now all of you are right and you understood this trick. So do remember, less than 3 by 60 is social blindness. Till 3 by 60 it is economical. That's all you never have to forget. Chalo. Now separation of healthy individual and infected animal not more than incubation period is known as quarantine. In quarantine, we focus on suspected healthy person and duration of quarantine is incubation. But in isolation, we focus on person who already have disease and isolation is done till duration period of infectivity. Till he can infect other, we will isolate. And do remember, both quarantine isolation come under primary level of prevention or specific prevention, because in both of them, we are trying to prevent those who are at risk. So specific or primary is there for quarantine isolation both. Okay. Now, next question. Researcher was conducting a study in relation to depression associated with history of social media use. One group had social media user with depression, other group had social media use without depression. Which type of study design is used here? So can you give me the answer of this question? How to identify such question? Keep guessing, keep giving answer till I will explain how to give answer. In all such answer, you have to look what is the reason, what is the karan, cause, and what is the effect. Cause means in Hindi we can call it karan. In English we can write it as risk factor or exposure. And effect means the disease or the outcome. So first draw a flowchart in your mind. What is the reason? What is the outcome? Now, if they are talking about two groups, then cross-sectional and ecological are ruled out. Because cross-sectional and ecological, these two will be correct if there is one group or one population. In 99% case, if they are asking question on cross-sectional ecological, there is one group, one population. Now, what is the difference between cross-sectional ecological? In cross-section, we will ask question from everyone, or we will collect data from everyone. Everyone is data collected, it will become cross-sectional. And which type of data we collect in cross-sectional? We collect the data of prevalence. Prevalence data collected from everyone. That's why cross-sectional study is known as prevalence study. Now, in ecological, we do not collect data from anyone. No data from participant. So what we do in ecological, I hope you all know, we just correlate hospital data with population data. So if you are taking data from everyone, cross-sectional, taking data from no one, ecological. So you can differentiate cross-sectional, ecological easily. Now, whenever there is cohort case control, they are talking about two groups. So what is the answer here? Ihtisam Ahmad has given cohort, and rest students are writing either A or B. So you are confused between A or B. So let's see the question here now. Where does the story start from? Story start from social media use is the reason, depression is the outcome. Karan se parinam. The reason here is, cause here is social media use. And due to excess social media use, the outcome is the disease is depression. So in the question, if the two group is excess social media use present, excess social media use absent, that means they are talking about exposure present absent, answer will become cohort. Because cohort start with cause, karan, reason. And if the two group are exposed, non-exposed, it will be cohort. If they say depression present absent, with depression, without depression, depression is the disease, depression present absent if the two group is there, and answer will become case control. हम लोग कहते हैं ना भाई case है बे, case है बे means he have some outcome, some disease there. So if the two group is, do remember this part, if the two group is reason present, outcome or disease present absent, answer is case control. If the two group is exposure present absent, answer is case cohort. And like here, what are the two group you have to find? Is the two group exposure present absent, social media use present absent, then answer will be cohort. And if the two group is depression present absent, then the answer will be case control. So what is the thing here? See, they are writing one group had social media user with depression, and other group are social media user without depression. So what are the two group? With and without depression. So they are talking about disease present absent, answer will become case control. If the two group is reason present absent, or social media use access present, access absent, answer would have become cohort. So here the answer was B, case control. हो क्या रहा है इस स्टोरी में? In this study what they are doing is they are starting with one group which are depression, one group which are not having depression, and we all know everyone use social media. They are just taking the past history, that how many hour you use social media, past history of hour of use, घंटा कितना यूज किया सोशल मीडिया में, hour of use of social media. So let's say one group said I am using around 4 or more than 4 hours per day with depression group, and the people who are not in depression group, they said 80% of them said that I am using 1 hour more than or equal to 1 hour per day. So no depression are using social media less, more depression are using social media more. That means the two group is disease present absent, disease and without disease. If the two group is disease and without disease, then answer will be case control. If the two group is social media use access present, social media use access absent, then it means there is reason present absent, risk factor present absent, and answer would have become cohort. So you have to answer it like this. Very good, correct. Now let's come to question number 18. I hope you will be able to differentiate the type of study. If still there is confusion, please let me know. A male underwent vasectomy. After 3 months, his wife got pregnant. What advice should have been given to him post vasectomy? Abstinence for 3 months after the procedure, use of barrier method for 3 months after the procedure, OCP use for 1 month, female condom use for 1 month. So abstinence का मतलब होता है कि तुम उसको बोलोगे कि सेक्स मत करना 3 महीने. And even if you say कि do not do sex, he may or may not be able to control the urge. So giving the advice don't do sex is a useless advice. Give the second advice, that use condom for 3 months or sponge or diaphragm for 3 months. And some book they say till 90 ejaculation use condom. Who is going to count the number of ejaculation, man? It's so tough. So it's useless advice. Best advice is use barrier method for 3 months. If you will not give this advice, such kind of case can occur. And they also ask, what is the most common cause of vasectomy failure? Why vasectomy fail many a time? So one reason is this, not using barrier method for 3 months. Second reason why vasectomy fail, the real reason failure of surgery is misidentification of vas difference with other organ. Doctor cut lymphatics or other content of spermatic cord and they think we have cut vas difference. So misidentification of vas difference with other thing, that can lead to failure. Galat tar kaat di, and they cut the wrong wire, that lead to failure of vasectomy. Okay, next question. In a school scenario, school health guideline include which of the following? What is the minimum area they include? In one exam they ask this, and then second they ask what is the minimum area. So minimum area is not 5 square feet. I hope you all know minimum area is 10 square feet, and the desk should be minus. This is correct. Can allot 60 student? No, the maximum student per classroom is 40. Urinal should be at 60 student, and if you mixed student in a class with susu, student plus urinal, it will become potty, latrine. So 40 plus student, that means latrine should be at 100 student. I hope you all know that light should enter from left side and 25% area should be door and window. One more thing you should know is that a school health program is now included under Ayushman Bharat. School health program come under Vision Center of PHC, because at PHC we do screening, and in a school also we train teacher to do screening for low vision. So it come under Vision Center of PHC, and it also come under Ayushman Bharat. Why it come under Ayushman Bharat? Because nowadays in the school they are celebrating health and wellness day. This health and wellness day, they can ask you in exam, is celebrated on which day? So this is celebrated on every Tuesday. And in this health and wellness day, we will select one male and one female student. Why? For couple yoga? No. We will select them as health and wellness messenger. And we will also select one male and female teacher as health and wellness ambassador. And on the Tuesday, they will motivate a student for yoga and meditation, because you all know yoga se hoga. And so in health and wellness day on Tuesday, messenger, which will be student, ambassador, which will be teacher, will motivate a student for yoga. And because health and wellness day is included in school, and in Ayushman Bharat also there is 3 parts. One part is health and wellness center, sub center and PHC will become health and wellness center. Second part is a school health program because of the health and wellness day. And third part in Ayushman Bharat is Pradhan Mantri Jan Arogya Yojana, in which logo there are 5 green leaf representing 5 lakh rupees insurance given to economically weaker section. So that is the third component, PMJ. PMJ 5 lakh insurance for economically weaker section, not to BPL category. Next question. A researcher, so do remember Ayushman Bharat, what are the 3 things? Health and wellness day under school health program, health and wellness center, and Pradhan Mantri Jan Arogya Yojana. 3 things come under Ayushman Bharat. Now a researcher underwent half engineer is saying कि we should do more question or we should do more theory in this time. So definitely dear, we should do more question, because exam is of question, not of theory. If you will do more questions, you will be able to develop recall ability. And all the exam, they do not check our knowledge or intelligence. They only check whether we can recall under exam pressure or not. So do practice every day, 5-6 hour practice of PYQ should be done. Now next question, a researcher undertake a follow-up study. Follow-up study is the other name of cohort study, because in cohort we go in future, we do follow-up. And they are saying they are doing it for certain time period, and people increasingly develop disease with time. What is known as? This is known as incidence rate. Incidence they have given as the option, but the correct answer is incidence rate. What is incidence rate? Incidence rate means how many new cases occur in how many people multiplied by time. So whenever you find time word in the question, that is talking about incidence rate. Now, what is cumulative incidence? See, this cumulative incidence is same as incidence. So cumulative incidence and incidence is not difference. No difference. What is the meaning of it? Cumulative incidence means, again we are writing the new cases which will develop, but this time we divide them by total susceptible. Susceptible are those people who can acquire infection, who are at risk of acquiring infection. Total susceptible. जिनको infection हो सकता है वो सब susceptible हैं. Those who can be infected are susceptible. So what is total susceptible means? Total susceptible simply means we will take population, we will subtract those who are already having immunity. Immunized we will subtract. And we will also subtract those who already just develop infection in first round infected. Because if you are already infected in first round, now you cannot develop infection again in second round. So people who are infected, we will subtract them. Immunized, we will subtract. If we will subtract these two people, it becomes susceptible for next infection. So do remember, cumulative incidence and incidence are same thing, and whenever they ask time word in the question, answer will go to incidence rate. Now, this was the next question in FMGE August 2020, that a research did a study on staff nurse and JR, doing staff, nurse and JR. So there are how many group? 3 group, staff, nurse and JR. And they compared and find out that there is 25% less risk of infection. So which test is applied here? ANOVA, chi-square, Z or correlation? Please, my dear friend, I will be waiting for you to give the answer. What is the answer here? See, if there is 3 group, answer can be 2 things. Either it can be ANOVA. ANOVA is analysis of variance, or it can be chi-square. 2 things can occur from 3 group. Now, chi-square is not only for 3 group, it is for any case where there is 2 or more than 2 group. So of course 3 group is also more than 2 group, that is chi-square. But what is the difference between them? The difference between them is chi-square is applied when there is qualitative data. Qualitative data is known as categorical data, which we can divide in category. Like if I ask you about my color, you cannot say that you are, sir, 6.2 dark. It's only you can say you are gray, dark, and there is some zone like that. So it is just category. Qualitative data include all disease. If I say hypertension we cannot measure. What we measure is BP. So BP is quantitative. But hypertension, diabetes, anemia, all are qualitative. And if in the exam they use the word percentage or median or median or mode, percentage, median, mode, this again indicate chi-square test. Because if I say in the class 10% student are anemic, so anemia is the disease, qualitative, and percentage qualitative. So in qualitative data, answer will become chi-square. Now, if there is quantitative data, quantitative means the thing which we can measure. Like in last MCI, they asked, where will you put cholesterol or bilirubin level? So we can measure cholesterol, we can measure bilirubin, we can measure BP weight and all. So all of these are quantitative. Measurable data are quantitative. And cholesterol, BP, HB we can measure, which is quantitative. And in the exam, if there is quantitative data and they give the option pre-post data or match data. Pre-post means, suppose you found a new anti-obesity drug and you are measuring the weight of 100 student before giving drug, after giving drug. So it is pre-post. Match means you are giving your new drug to 25-year student and you are giving the old drug, let's say Orlistat, also to 25-year student. So this is 25-year student getting your drug, 25-year student getting some other drug. So 25 is the same age group in the 2 group. This type of data is matched. Match मतलब एक जैसे लोगों को दवाई देना match है. If you are giving it to the same type of people, it is matched. So not exactly same, but almost same. So if you find pre-post or match word, answer will become paired t-test. If you found 2 group, answer will be unpaired t-test. And other name of unpaired t-test is student t-test. And if you found 3 group or more than 3 group, answer will become ANOVA. So when the data is measurable, BP, HB and all, you will look at pre-post, before, after, answer will be paired, 2 group unpaired, 3 or more ANOVA. And if you found any disease name written, percentage written, directly tick chi-square. Okay. So here in the question, we can see they have used the word 25% people have decreased risk of infection. So because they have used the percentage thing, answer will be chi-square. Second hint is infection. We cannot measure infection. We can only say mild, moderate, severe infection. So infection is in category. Categorical data chi-square. Third hint is here they have given multiple bar diagram. Because you can see gap is always after every 4 thing there is gap. And bar diagram is also for qualitative or categorical data. So because it is qualitative data, answer is chi-square. Now in the same question, rather than measuring infection, if let's say I measured CRP level of 2 group. Now CRP is quantitative because we can measure C-reactive protein. It is measurable thing, quantitative. 2 group, answer will become unpaired or student t-test. If I say unpaired t-test, if I say CRP level of 2 group, unpaired. If I say CRP level of 3 group or 4 group, answer will become ANOVA. And if I say CRP level before and after yoga, so before and afterward you will use, answer will become pair T test. So the same question can be asked in two way. You have to focus what is the thing they are measuring, वो नाप क्या रहे हैं, और जो नाप रहे हैं वो कैटेगरी में जाएगा या नापा जा सकता है. What they are measuring, is it categorical or measurable? Like here they were measuring infection, which is categorical, so answer was chi-square. But if it is CRP, I hope you understand how we decide this test and you will not forget it. Now minimum number of antenatal visit is 4. But if they say minimum number of antenatal visit in WHO, it will become 8. So in WHO it's 8, in India it's 4. You will tick 4. Even if 8 is an option, you will choose 4. Unless they use WHO, you will not tick 8. Okay, next question. Dr. Devender Singh is saying, love you, sir. Love you, bro. I love you too. So now, a person returning from malaria endemic country should continue chemoprophylaxis for how long? I hope you all know the answer. How long? For how long they should take chemoprophylaxis? They should take chemoprophylaxis for 4 weeks. Very good. Prashant, Harish Raj Purohit, Karthik, Mukesh, all of you are giving correct answer. It is 4 weeks post after coming back. Let's say someone came from UK to India, 4 weeks they will keep taking anti-malarial drug. But if the duration of stay in endemic country is less than 6 weeks, then the drug they should get is doxycycline. If the duration of stay is more than 6 weeks, then the drug they should get is mefloquine. So based on what is the duration of stay also, we have 2 different drugs which we give for chemoprophylaxis. Now, in a different type of graph, secular trend of disease is best represented by. So we all know secular trend or any trend is represented always by line diagram. Trend by line diagram. Now, what does box and whisker plot represent? Box and whisker plot look like this. This is the box, 25% to 75, and this is the poochie. Whisker means tail, and box and whisker represent outlier, and it is also used for Q test. So Q test and outlier by box and whisker. Stem and leaf plot image based question has came already in one of the exam. Let's say I am writing your BP. It is coming 124, 128, 130. So in box and whisker, last number become leaf, remaining number in stem and leaf plot, last number become leaf, remaining number become stem. So what are the stem? 12 and 13 are the 2 stem. They will put it like this, and they will put 4, 8 and 0. So this type of image based question can come. It is stem and leaf plot. Stem and leaf plot help us to know the exact BP distribution. Exact data distribution is by stem and leaf plot. Now, bar graph is just for quality, but they can ask one more thing. What is the use of scatter plot? Chitraya hua plot. A scatter plot is for correlation. Correlation between 2 variables is by scatter plot. Like if this type of correlation is there, it is which type of correlation? Positive correlation, and correlation coefficient will come someone around 0.9. But if this type of correlation going towards negative side will come, it is negative correlation, R will be minus 0.9, and total correlation of this will be roughly equal to 1. No, roughly equal to 0, because one side is plus 9, one side is minus 9. This image based question also come. This type of correlation can occur if we are talking about number of cigarettes smoked per day with age. So we all know with age till 40 years cigarette smoking increase. Increase means which type of correlation? Positive correlation. And after 40 cigarette smoking decrease, so negative correlation. And finally the correlation is 0. It means cigarette smoking is not related with age. It's not that when you are 30 years you automatically start smoking. There are multiple factors. So if a graph is going up, positive, going down, negative, total will be 0 correlation, no correlation. And I hope you can answer this question. Sometime in correlation they give you this 2 question also. One time they gave you this dot are very far away in A and dot are very close. So which has a strong correlation coefficient? Answer is B. B will have correlation coefficient around 0.8, A will have correlation coefficient around 0.5. If dots are close, it indicates a strong correlation. Second thing they can give you, there are 4 studies, each with correlation coefficient of 0.6. 4 studies with correlation coefficient same 0.6. What is the final correlation coefficient? So because each study have correlation coefficient equal to 0.6, the final correlation coefficient will also be same 0.6. So these are some of the questions from correlation. Do remember them. Next question, which of the following is indicative of severity or lethality of disease? Severity, lethality, or virulence? Killing power. Virulence means killing power. These all are best represented by case fatality rate. Case fatality rate simply means we will write total case of the disease below and we will write death due to that disease above. And we multiply it by 100. For example, they have asked what is the case fatality rate for rabies? For rabies, it is 100%. It means if 100 cases of rabies occur, out of them, all 100 will die. Okay, so that is the case fatality rate thing. Killing power, and rabies is highly lethal, virulent. Being Human is appreciating me and saying you are a good teacher of PSM. And he's saying best, but I have edited that. Thank you for appreciating. Everyone is hungry of appreciation. Sometimes do take time and appreciate your parent also. Then they will appreciate you also. And try it. It's difficult, but you can write a love letter to them. Appreciate them. They need it, and they're doing the hard work. So if you are head of NBDCP, malathion spray should be done at which frequency? Malathion is spray once every 3 months. If it comes to DDT, DDT is spread every 6 months. And DDT is what is given in national program. We give NVBDCP is the program for 6 disease. NVBDCP is there. Of course, malaria, dengue, chikungunya, kala azar, Japanese encephalitis, and filariasis. 6 diseases come under NVBDCP. 6 months is DDT, and therefore we use DDT because it needs less manpower. But malathion, do remember, is least toxic organochloride. Least toxic organochloride is malathion. Now, there is one other question which comes from toxicity, that is the logo. They will give you image not of red color but of yellow color, and they will ask this yellow color. Can you see the yellow? Yeah, you can, but very differently. So if they give yellow color, they ask which type of toxicity is it? Is it extremely toxic, highly toxic? And we think highly should be red. So, or is it moderate toxic? So we think highly should be red. We answer it moderate, but no. Red is for extremely toxic insecticides like zinc phosphide. Yellow is for highly toxic. Do remember, yellow do not need moderate. Yellow means highly toxic. And if you give you this blue logo, this blue logo is for moderate toxicity, and example of moderate toxicity is malathion. And if you give the green logo indicate, of course, safe for human use. Like all the mosquito vaporizer which you have in your room, if you turn it back, there will be green logo in it. Okay, so that's green there. Now, next question is newborn health mission component do not include which of the following? Newborn health mission do not include. So target of IMR to double digit by 2030, this is not included because IMR is already in the double digit. The current IMR of India is roughly around 25 per 1000 birth. So it is already in double digit. It cannot be the target. Antenatal case, postnatal case, and care during labor all are under newborn health mission, but not this. Because in this question, a student will think care during labor is not related to newborn. They will tick that. But if we will give care during labor, then it will lead to less premature delivery. And do remember, premature delivery before 37 week of period of gestation is the most common cause of infant death. So this is the first cause of infant death, premature delivery. Then After this, the second cause is asphyxia. After birth, due to meconium or prematurity, they are unable to breathe. That is second reason. Third reason is all the pneumonia death which can occur. Fourth reason is the sepsis death. Then there can be other reason like diarrhea and accidental death. So diarrhea is fifth, accidental death is sixth. But do remember, the least common cause in India is congenital anomaly, is least common. But in US, UK, most common is congenital anomaly. And this you can represent by pie chart. Like here, 28% will be premature delivery, then there will be pneumonia, then there will be sepsis, diarrhea, accident. Least common will be congenital anomaly. Okay, so sometimes they ask the sequence also to remember it. Next question. A child reported to a PHC with runny nose. So if the nose is running, chickenpox rubella is gone. Because in chickenpox rubella, there is dry fever. Runny nose, simple answer will be measles only. In mumps, we all know there is swelling below the ear lobule, and the infection of mump can go from extension duct to our oral cavity. Remember, extension duct open near upper second molar, and cochlear spot of measles is towards lower second molar, lower first and second molar, not upper. Upper is for extension duct. And cochlear spot, we all know, is white spot on the buccal mucosa, which is pathognomic for measles. Now look at the question. The second hint they had given is rash started from face, then covered trunk and back. So kaan ke piche se, and I started from face, back of hairline, then to face and then to body. Answer will be definitely measles. And anyway, you can see the rashes are not coming out. They are in the skin surface, so that is measles. A country is suspecting a severe disease. What is the probable time within which it should be reported? It should be reported in 24 hours. How do we report it? We report it by integrated disease surveillance program for any disease. And to where we do report it? First reporting should be done at PHC. Now, do remember, PHC is also used for reporting of birth, death, and outbreak. Outbreak means any large number of cases occurring very quick time, that is outbreak. Now, outbreak is same as epidemic. So PHC is for birth, death reporting. They have asked this question that where will you report the marriages? So marriage will be reported at sub-center in rural area and in office of sub-divisional magistrate, SDM office in urban area. So if you will go for court marriage, you have to go to SDM office in urban area, but in rural sub-center. Now, one more question from here is, sorry for the cough, birth and death registration, it come under which reporting system? So birth and death are registered under civil registration system. Civil registration system. And birth and death reporting should be done within how many days? Within 21 days, we should report birth and death. Do remember, there is one system of reporting of IMR and MMR, that is SRS. SRS is sample registration system, and they ask this question that which one is dual data reporting method. So sample registration system, what happen is first time ASA go visit home and or health worker go and visit home and make a report. Then a supervisor go again after 6 months and make a separate report. Then these two reports are cross match, and finally the cross check data is released every 6 months. So in SRS we are collecting the data twice. That's why SRS is dual data reporting method. Okay, and SRS give us the data of infant mortality rate or MMR, maternal mortality ratio. So IMR, MMR come from SRS. Okay, next question. In a hospital, do remember one more thing, census give us sex ratio, socio-economic status and all, but census do not give us death data. Death data is not coming from it. Okay. A lot of other data, census also give us economic status of the family, socio-economic classification, caste data also can come from it, economic data can come from it, but not death data. And census is done every 10 years, which is not being done for last 14 years in India. Now, in a hospital, systematic observation and recording of doctor time with patient. क्या हो रहा है यहाँ पे? वी आर टेकिंग इनटू केयर कि कौन डॉक्टर है जो पेशेंट पे टाइम ज्यादा दे रहा है, कौन है जो बकबक ज्यादा कर रहा है मेरी तरह. So we are reporting the time taken and comparing based on them. That is work sampling. If it is extracurricular work, it will become system analysis. If it is group method, that is Delphi. We already have done it. Now, first investigation of TB diagnosis. If they ask first investigation, what will be the answer? I want the answer from all of you. This is a question which they ask again and again. First investigation. A, B, C, D. I want to see your answer. First investigation. Very good. Most of you are saying sputum. Some are saying CBNAT, cartridge-based nucleic acid amplification test. Now my question to you is, if it is diabetes, then what is the first investigation? If they only write first investigation for general public, answer will be sputum smear or ZN smear. And they have asked, how do you label the two sputum of ZN smear? They are labeled as capital A and B. First is given a spot, second is given early morning or after 2 hours of a spot sample. So capital A, capital B, ZN smear is for the general population. But in 5 cases, first investigation is CBNAT. And this was the question in recent MCI being asked, that HIV first investigation CBNAT. Similarly, second is diabetes. Third is the, what is the third? Third is the COVID-19 patient, we directly do CBNAT. Fourth is previously treated patient who already has been treated, but again came, they will go for CBNAT, because CBNAT not only diagnose TB, but also detect rifampicin resistance. Okay, and then after this fourth, the last is pediatric TB suspect. So why are we doing CBNAT in pediatric TB suspect? Because बच्चों को जानते हो ना, बोलोगे कि थूक दो तो मूत देंगे, बोलोगे मूत दो तो थूक देंगे, है ना? Children, if you will ask for give sputum, they will urinate. If you will ask for urination, they will produce sputum. So it's very difficult to collect sample from them. That's why in these 5 cases, if sample is collected, directly send them for CBNAT. In all other, the first is sputum smear. Now, if they ask the question, what is the best test for spread of TB? Spread of TB, we want to know only the infection, because TB disease do not spread, TB infection spread. And for infection, we have tuberculin test, which is also known as Montoux test, in which we insert 0.1 ml purified protein derivative RT8023 sample, and purified protein derivative PPD 0.1 ml we put, and tuberculin is best observed at 72 hours. The second test for infection is interferon gamma release assay. So if they say spread of TB, answer will be tuberculin, because IGRA is very costly. And they have asked in NEET 2018 which test take whole blood sample, that is IGRA. In IGRA, whole blood sample is taken. But if they ask best test for screening or first investigation for TB or screening, if they ask, screening is done by ZN smear. Screening is by ZN smear. And if they ask the gold standard for TB diagnosis, what is the best test which you can do for TB? Gold standard for TB is not CBNAT, it is culture in liquid medium. Because CBNAT can sometime overdiagnose. It can give atypical mycobacteria also as TB. That's why culture in liquid medium is gold standard. And I do remember these various questions coming from investigation. One more question I want to ask from all of you is that, let's say you did a sputum smear on the patient and 2 ZN smear came negative. And both ZN smear suppose came negative. But X-ray is suggestive of TB. Patient symptom X-ray is suggestive. What is the next thing you will do? Next, what you will do? What is the best next thing? Option A, you will give antibiotic for 2 weeks amoxicillin 500 mg, and after giving antibiotic for 2 weeks, you will repeat ZN smear. Option B, you will send the patient blood sample for CB NAT. Option C, you will start treatment under clinically confirmed TB because the symptom is there and X-ray is positive, so start treatment under clinically confirmed TB. Or the last option is because 2 has came negative, so it may be the sputum sample is not taken properly, so we can repeat ZN smear or repeat ZN. So what will you do in this patient? Please do reply, my dear friend. What do we do if 2 sputum sample is done and what will you do? What is the answer? Please, I'm waiting for your reply. The correct answer, because this question has came 3 times already, so I am taking this time for your answer. Correct answer is you will do CB NAT test, which is same as nucleic acid, catalyst-based nucleic acid amplification test, which is same as PCR, because the technique which we use in CB NAT is polymerase chain reaction, and it is also same as True NAT TB test. This is developed by India. Low cost CB NAT is True NAT. Okay, so this is the answer. We can start treatment under clinically confirmed TB, but in India it is allowed to start treatment under clinically confirmed TB, but let me have it. Let me have it. This clinically confirmed is allowed in India nowadays. It's not that we cannot start, but we will first try to go for CB NAT. If CB NAT not available, let's say you are in tribal area or somewhere, then you can start under clinically confirmed. And this is what we do practically, give amoxicillin 500 mg twice a week, but not theoretically. So correct answer is CB NAT, do remember. Okay, very good. Most of you gave the answer B, but some are also giving A. They are practically correct, but not theoretically. Theoretically answer is of course B, CB NAT. Prakash Kumar is sending me love from Nepal. Thank you, Prakash. You enlightened me also, and very good. In ORS, what is the role of sodium? Sodium, does it help in facultative diffusion or does it help in co-transport or osmosis? Can you give me the answer? ABCD answer is it is for co-transport, not for facultative diffusion. And this co-transport occur with SGLT1 protein. This protein help in co-transport. Very good. Most of you gave the answer correct. Now let's come to 2021 question. Maternal of death per 1 lakh live birth is known as maternal mortality ratio. Why it is ratio? Because in ratio, numerator is not a part of denominator. And they ask a lot of questions from MMR. So let's read what is the formula of MMR. MMR, it includes maternal death. They will confuse you. Is it only after delivery or both before after delivery? Maternal death before and after. Until how long after? So before, that means during pregnancy, or 42 days, within 42 days after delivery. Okay, or up to 42 days after delivery. So up to 6 weeks or in pregnancy. If anyone die, that is MMR. But they should dying due to delivery related causes. Then only we will call it maternal death. If someone die, let's say after my delivery, I'm a mother, I put my finger in electric short circuit and I died. That is not maternal death. If I drown, that is not maternal death. But if I got depressed after delivery, that everyone is looking at child, no one is caring for me, and I went to the rooftop and I jumped from there, that is postpartum blue, depression. That is maternal death. So it should be due to delivery related causes, due to delivery related death, pregnancy related death. And of course, the denominator is not total mother. Denominator is total live birth. and we multiply it by 1 lakh. So correct answer is, why it is ratio, you can understand. Mother are not coming from live birth na. मेरे में से माँ थोड़ी निकली है ना. Mother is not coming from children. We came from our mother na. So numerator is not coming from denominator. That's why it is ratio. In rate, numerator is a part of denominator. And like one more very good example of ratio is sex ratio. In sex ratio, we write female above, male below, and we multiply by 1000. So we all know female do not come from male. They are separate. That's why it is ratio, because numerator not coming from denominator. Next question. Evaluation of birth and death is done by civil registration. We already did it in the previous question. NFHS, National Family Health Survey, and DLHS, they give us data of immunization. They also give us data of anemia, domestic violence, which is reported as 37% in country, very high, and iodine deficiency, and breastfeeding data. So all these data come from NFHS, DLHS, birth, death, civil registration. SRS, as I discussed, give data of IMR, MMR. Double data recording is in SRS, and census give us sex ratio, caste data, economic data, but not death data. Coming to next question, quarantine period for plague in prehistoric era was 40 days. But if they remove this prehistoric era, then the answer will be 2 to 7 days, 7 or 8 days. To 2 to 7 days now for plague, but prehistoric era 40. Previously we used to isolate till the person, quarantine till the person die. Like in North Korea, one case of COVID came, how they managed? Shoot him direct. No need of quarantine. So like that we used to do in the past, quarantine till 40. But now it is for 2 to 7 days. And we all know quarantine is done till period of incubation. So incubation period for plague is 7 days. Nowadays, now 7 days maximum, 2 to 7. Population covered under plus minus 1 standard deviation of mean is 68.3. I hope you all know, but what is the answer to do this? Population under mean plus 1 standard deviation will be, what will be the answer to this question? Try to answer. Option A, will it be 0.68? Will it be 0.47? Will it be 0.34? Will it be 0.95? What is the answer? Please do give me the reply. And you are giving reply very good and very fastly. I'm liking that. Do give me the reply. What will be the answer here? This is the mean. We all know between minus 1 and plus 1, how much value lie? This part will have 68% value total. Total value 68, which is correct. Between minus 2 to plus 2, we have 95% value between minus 2 to plus 2. And between minus 3 to plus 3, we have 99% value. So how many is mean plus 1? Very good. Sweta Sinha has given the correct answer A. Apart from Sweta Sinha, around 10 students got tricked by me. Correct answer is not 0.68. Correct answer is C, 0.34. Why? Because here I am not asking plus minus 1. Plus minus 1 will be 68. When I am asking mean plus 1, it means I am just asking about this part, half of 68. And half of 68 is 34%. So then the answer will be 0.34. Okay? But plus minus 68. Do remember this very two important formula. 68% confidence interval is mean plus minus 1 standard deviation. 95% confidence interval is mean plus minus 2 standard deviation. I am having this high hope that in this MCI exam, they will give you a numerical from these two simpler formula. Very frequently asked numerical from this simple formula. Do remember the formula. Now, identify the benefit if an insured person is taking a treatment. If it is taking a treatment, it's direct medical benefit. Okay, maternity benefit, is it for 24 week, 26 week, 28 week or 30 week? How much is the maternity benefit? Do reply. 24, 26, 28, 30. Sickness benefit is, I hope you all know, 91 day. Extended sickness benefit, they have asked it previously also for 2 years. But if they say enhanced sickness benefit is 7-day for vasectomy and 14-day for tubectomy. So enhanced, they are cutting the wire. And of course, cutting my wire vasectomy is very easy, because the ball is already hanging down, easy to cut. Tubectomy is more tough, so 14-day. Remember, extended is 2 years, but enhanced 7 and 14-day. And of course, we will get 100% salary here because we are cutting our wire for the country also. So that's there. Okay, most of you answer 26. 26, Devender, Jakir, Nidhi, all of you are correct. Answer is 26 week for maternity benefit, not 28. It's 26. But similarly, they ask that what is the time to do random blood sugar in pregnancy? What is the best time to do random blood sugar in pregnancy? And we do RBS at sub-center. We only do RBS, not fasting, because it's difficult to put villager for fasting. And so it's random we do. And the ideal time is not 12 week, is 24 to 28 week. If they ask one answer, the better answer will be 28 week. Okay, so for RBS answer is 28. But for maternity benefit, it is 26 week or 6 month. RBS better is 28, do remember. Now, identify the social worker who is posted in the same village is 32 8th pass. 8th pass. If they use the word 8th pass, answer is ASA. You can find a lot of teacher teaching that 10th pass is the criteria for ASA. But they are Google answering it from Google. If you look at Park textbook recent edition at 3 places, they have said minimum education for ASA is not 10th, it is 8th pass. And there is only one ASA per 1000. At the end of the class, I will show you those 3 places photo where they have written it in Park that it is 8th pass, not 10th. 3 places they have written. I will show you all those 3 image here only. Trust on evidence, not on expert. Trust on evidence, which is there. Okay. So answer is ASA for 8th pass. If pregnancy kit for follow-up at home, pregnancy kit, if they ask, it is Nischay. Nischay is for TB reporting and follow-up. TB reporting and follow-up by private and government both is Nischay. Private and government do both, doctor and hospital. So how will you remember it? In Philippines, a student told me this way, that if S is coming early, S early means sex, and sex will lead to pregnancy. So in Nischay, S is coming late, in Nischay, S is coming early, so it is sex pregnancy thing. Anyway, if you see, the Nischay word means to be sure of. So they want us to be sure of pregnancy, that's why it is Nischay. And when I say Nischay, Nik means no, Chay means loss of body, which is for TB. So Nischay is TB reporting, Nischay is for pregnancy kit. Identify the food with more sodium content. So it's a controversial question, more sodium content, and they have not given which soup we are using. And now it depends on the soup also, which is there. But most of the places, the sodium content which is there, maximum here, they say is bread. Because they can have some soup with less salt also. But usually the bread have this salt content, which is higher than cereal or green vegetable. Because in cereal and green vegetable and soup, in all these 3, we add sodium. It's not already there, we add it. But in bread, some sodium content is always there. So it's controversial, but the answer which I found at multiple places is bread. I read Park, but it was not written there for bread. The burden of disease is defined by best by Daly. Do remember, Daly is the best indicator of burden of disease. It has 2 factors. One is PYLL. Other is YLD. What is PYLL? This was the NEET question also. PYLL means premature, not ejaculation, premature year of life lost. Premature year of life lost means year of life lost due to early death. If someone is dying early, that is PYLL. This was a neat question, and usually actually they don't have PYLL in the definition. They have only this YLL. But I also wanted to teach you that what is PYLL. So PYLL is premature year of life lost due to early death. YLL is also the same thing, year of life lost due to early death. So let's say someone in India died at 62 years, and the year which is expected to live was 70 years. 70 years is the life expectancy. Someone died at 62 years. So how much early he died? He died 8 years early. This will become the year of life lost. Second is year of life lived with disability. I'm telling it in detail because this area they ask question again and again. Year of life lived with disability. So like it can be the story of my father also. He lived with hemiparesis for 10 years. And when I was in second year, he developed hemiparesis and he died some 5.5 years back. So for 10 years, he had hemiparesis and he died at 62 years. So 8 years early. So total DALY will be 8 years early he died, and 10 years is the life with disability. Total 16 years will become the DALY. Okay. And what is Sullivan index? Sullivan index means how many years you lived healthy. Year of life lived in good health is Sullivan index. Now, the formula for Sullivan index they can ask you in this exam also, that is life expectancy minus DALY. And that's why I gave you example of my father to explain these two concepts very well. The life expectancy was 70 years in India, and the DALY for my father was 18 years. And because 8 years he lost, 10 years early he died. So if you subtract 70 minus 18, it will come 52 years. Until 52 years, my father was healthy. So that is Sullivan index. How many years you were healthy? And I'm not so sad while talking my father death, because I know, being a father myself, I know that every parent from the core of the heart, they only want one thing, happiness of their kid. So if I am remembering my father, I should still be happy because that's what his wish was. And you should be happy to fulfill. That's the main wish of your parent. Rest all things they say is just superficial. Don't see those superficial words. They're asking you to pass. That is, their purpose is that you will be happy after passing. That's why they're asking you to pass. Only see their heart, not their word. Their heart is wishing for your happiness only. And so Sullivan index, year of life lived with good health, life expectancy minus DALY, and burden is DALY. But nowadays they are asking a lot of questions from QALY. In the question, if you find the word intervention is QALY. What is QALY means? QALY means how many year added due to intervention. Like they can give you this question that Japanese government is doing a lot of intervention to increase life expectancies of Japanese population. It will be example of which thing? QALY. QALY is quality adjusted life year, but you can adjust the word adjusted, remove it. So it is quality life year added due to some intervention, like dialysis add 0.5 QALY in life of patient. So QALY, whenever you find intervention, you will answer QALY. Whenever you find burden, you will answer DALY. Whenever they ask healthy life, good health life lived, Sullivan index. And what is this HEL? Sorry for the cough. HEL stands for health adjusted life expectancy. Again, you can adjust the word adjusted. So HEL will stand for healthy life expectancy. Now you will say that, sir, Sullivan index is also telling healthy life. HEL is also telling healthy life expectancy. So what is the difference? The difference is healthy life expectancy at birth is HEL. At death, how many life you lived healthy, that is Sullivan index. At birth, what is the estimated healthy life you can live? That is HELI. Like my daughter, Prisha Lakshmi, cute one, she had less HEL than the HEL of a girl who took birth in Japan. So a healthy life expectancy is estimated at birth. Do remember these 4 indicators separately. If you want to teach people how to make ORS, the best way will be demonstration. Role play, not the one which is done in bedroom. This is different role play. This role play is done in front of around 20 to 30 people. We act, not that acting, but we act about their cultural belief and we show it to them that you are doing it wrong. Let's say in snake bite, nowadays they are doing this work of, they are using the logo do it right. What is right? R stand for reassurance. You will reassure the patient that nothing wrong will occur, don't worry. I stand for immobilization, not for incision. Immobilization means you will not let the patient walk. You will take him on a stretcher or wheelchair. GH means go to hospital. G is go and H is hospital. And T means tell history in detail. How was the bite? What are the symptoms after bite? So this is the Indian guideline, but what happened in rural area, they took the snake bite people to some Baiga Baba and all, and sometimes they put turmeric powder, this mirchi powder, they pepper and all they put it. I used to ask, why don't you also put garam masala? Let's make it a proper chart. So they put all this thing on it, and they sometimes you can see they are sucking the blood, and in movies also they show. So these are wrong practice. So you can do the role play and tell the villager that these are the wrong practice and correct thing is this. So role play help in telling them what wrong they are doing. Flashcard is used for telling nutrition to mother. Let's say you want to tell that these are the healthy food, these are not healthy food. All this can be told by flashcard, one after another. Group discussion, again and again question come, we will discuss it later on also, is done between 6 to 12 people. They have asked in one time, how many population is there? 6 to 12. They will sit in the circle, and in the recent MCI, they ask a very good question. Is it an open discussion, closed discussion, or is it a meditated discussion? Meditation means you are guiding it, how to talk, what to talk and all. So group discussion is a guided discussion. Do remember, guided discussion means there is a person who is the in charge. He will give them a topic, and if someone is deviating from the topic, he will bring them back. So this is not open or closed, this is guided discussion. Okay, like I did a FGD in my PG at AIIMS New Delhi. Their topic was why villager want to donate organ or not want to donate organ. So I just kept them in the top loop by asking this question. I asked them to sit in a circle, gave them the topic, and don't let them deviate from it. So it was a guided discussion in 6 to 12 people, that is group discussion. Now one more question come from here is panel discussion and symposium. What is the difference between them? See, when they talk about panel discussion, in panel discussion, there is fixed manner in which people will speak one after another, fixed sequence of speaking. But in in panel discussion, there is no fixed sequence of speaking. But in symposium, which is known as sangosti in Hindi, symposium, there is fixed order of speaking. So which one is better? Panel discussion is better because in this, the order of speaking is not so fixed. Second thing, in panel discussion, audience can ask question in between. But in symposium, audience can ask question only at the end. So symposium is boring, fixed order, panel discussion is better. Okay. Nidhi is saying 4 to 6 member. No, it's not 4 to 6 member, it's 6 to 12 member. And there is set agenda. The order is not fixed. In FGD, they are focus group discussion or group discussion. They are sitting in circle. So there is, sorry. Nidhi is talking about panel discussion. Oh, not about group discussion. Nidhi, you were correct. Panel discussion, there is 4 to 6 expert. Very good. 4 to 6 expert, no set speech, no set agenda. Agenda is set, but they can deviate and talk about it otherwise also. That is panel discussion. Very good, Nidhi, you are right. Now, let's say if the couple has given birth to their first child, what phase of family cycle are they in? So, what is this? Is it formation, extension, contraction, dissolution? Actually, there are this 5 phases to which question came. You can see 3 years back and in recent exam also. And we should check all this thing how we do this thing. What are the sequence of event in family cycle? Let's have the image directly from the Park textbook. These are some of the question which I have put it here. So this is the Park textbook image. You can see in one of the exam they ask the sequence of event. In one of the exam they ask what do we call it if it is ending and all, na? Like, bro, it's cutting there. Bro, इसको कैसे बड़ा करें? हाँ, now you can say, हो गया, I did it. बस उंगली करनी थी सही जगह पे, I did it. So, marriage and birth of first child is formation. Do remember this and revise it with me. Marriage and first child is formation. First child to last child is extension. Mostly they ask question from third phase, complete extension. And in complete extension, first child leave home. That is the ending of extension. So, it is confusing. People think extension means more people. But when they say complete extension is just before the first child leave home. So complete extension is birth of last child to first child leave home. Do not leave this point. After that, there is contraction when first child leave home and then last child leave home. Complete contraction when last child leave home and one spouse die. And then dissolution when first die and then last die. So I hope you will revise it and remember it. This part, this table is very important to revise and remember. Okay. This cycle of event. Now, let's go back to our question. There are many images and question which I have put. So I think I should increase my speed a bit. Do remember, like you understand the thing, I think. Formation is first child born is the end of formation. Like marriage, my marriage and one child, first child Prisha born, that was formation. Extension when first child was born and then last child, my last child Prithvi is born. After that, my wife went through tubectomy. Although I could have gone through vasectomy also, but in C-section they open it and then do it together. So she went for tubectomy. How much is the leave duration for tubectomy? That is 14 days. Which type of benefit? Enhanced or extended? Enhanced is for tubectomy and vasectomy. Extended is for 2 years, in which they give 80% of the salary. Okay. Now, what should be used to explain the nutritive value of various food? Best is pie chart for nutritive value. Pie chart, circular can be used. Pictogram is the simplest method for layman. We use pictogram. But if we are expressing diet, it's better to express it in this, like carbohydrate, protein and fat. So it will be pie chart. Next question. Information, especially of biased and misleading nature, that is definitely propaganda. Propaganda is reactive or reflective. Education is reflective. Reflective means they will let you think whether it is correct thing or wrong thing. But propaganda is reflexive. Reflex based. Reflex based means they do not let you think, just let you do the action. Like if there is suppose some communal violence or mob lynching and all, these are based on propaganda. It's not reflective. And of course, propaganda is misleading. Health education is giving us correct information. So reflective is here, reflex based will be propaganda. Next question. Vitamin A, a lot of question come from it. Vitamin A dose given to a child of 11 months presenting with feature of deficiency will be 1 lakh. Till 1 year, it is 1 lakh. But if it is weight less than 8 kg and age 1.5 years or 2 years, whatever is the age, if weight is less than 8 kg, again the answer will be 1 lakh. Okay. Now, do remember age, weight less than 8 kg or age less than 1 year. In these two, we always give 1 lakh. And In PET, they can ask the question, when do we give this 1 lakh? So this is given on day 0, 1, 14. 3 doses we give it. Okay. But what is the national immunization schedule says? National immunization schedule say that has been asked also 1 lakh at 9 month and then 2 lakh every 6 month. 2 lakh every 6 month till 5 year of age. So it is 1 year, 9 month, 1 lakh, then 2 lakh, 2 lakh, 2 lakh, 2 time, 2 lakh, 2 time at 2nd year, 3rd year, 4th year, 5th year. So finally there will be 17 lakh total dose and there will be 9 visit for it. And we give it on 3 doses for treatment. Remember this thing, if weight is less than 8 or age is less than 1 lakh, otherwise 2 lakh. Okay, I hope you will remember it. If you want to check for incidence of deafness, incidence means new case. New case. And when will you have your new boyfriend or new girlfriend? In future or in past? Of course, in future. And in which out of these 4 goes in future? So cohort goes in future. That's why whenever they talk about incidence, new case, cohort, whenever they call about prevalence, cross-sectional, whenever they talk about odds ratio, case control. Now let me ask you this question. Which will give us cross product ratio? Cross product ratio comes in which study? Tell me. Cross product ratio, which study? So if they use the word cross product, people think it's cross sectional, but no, cross product is the other name of odds ratio. It also come in case control. Okay. New case, incidence, cohort. Very good. Prospective. Correct, Prashant. Maximum number of candidate of group discussion is 6 to 12 for FGD. We just discussed it. It is a guided discussion. In a population of 10,000, sex ratio is more than 1,000. What is the correct statement? Very interesting question. Solve it and answer it right now. Please, I am waiting for your answer. Sex ratio, we all know. We write female above, male below, and we multiply by 1,000. So, what is the correct statement? Sex ratio more than 1,000 we need. Population is 10,000. B and B is coming. To answer this question, very good. Both of you, Dr. Labeta Lol, Lebeta Lol, sahi answer. Vishal Thakur, Sweta Sinha, all of you are correct. Nidhi is correct. Prashant is correct. And Vishal is definitely correct. So how to do this question? First thing is, we will divide this population into 2 halves. Whatever is the population, we divide it into half. Now, if sex ratio is more than 1,000 means female should come more or male should come less. If female is more than half population means more than 5,000, sex ratio is more than 1,000. If male is less than half population, again sex ratio will be more than 1,000. So divide the population into 2 halves. There is no option saying female more than 5,000. Only option which is saying male less than 5,000 is B. So correct answer is B. You have to, if the sex ratio is more than 1,000, then you have to choose female more than half, male less than half. And answer will be correct. Next question. Land area required to fill trench of 2 meter depth with compact refuge of population of 10,000 is 1 acre. One more thing they have asked in recent MCI is, in a camp, what is the best method for fecal disposal? Answer is deep trench or shallow trench. Answer is deep trench. Deep trench best method, and for 10,000 we will dig 1 acre area. Okay. All are true for colostrum except colostrum is thick lemon color. Correct. More carbohydrate than milk. No. Colostrum will have more protein than milk. And they can ask, milk has maximum amount of, human milk has maximum amount of which of the following? Is it carb which is maximum in human milk? Is it human milk which is maximum? Carb, fat, protein, or iron and calcium? What is maximum in human milk? Answer will be carbohydrate, because carbohydrate is present in the form of lactose, and lactose is maximum in human milk. Then they have asked this one exam, in which milk protein is maximum? Cow, buffalo, goat, or camel, or human? Which is maximum protein? So do remember, no one can beat a bhainsia. Fat, protein, iron, calcium, all are maximum in buffalo milk. Okay. And human milk gives us 67 kilocalorie energy if it is 100 ml of human milk. The protein in human milk is 1.1 gram. In an egg, the protein is 6 gram, fat is also 6 gram, and cholesterol is 250 milligram. Egg lack vitamin C. Human milk lack vitamin K. Next question. If you want to reduce selection error in a clinical trial, what is the best method? Selection error means what you can do is you can choose young people in one group, old people in other group. And suppose you want to prove that your medicine to decrease obesity is good. So your new anti-obesity drug you can give to young people, and the previous drug or placebo you will give to old people. So of course new drug people will have more weight loss, and you will prove that my drug is better. So this type of bias where you are selecting different type of people, young and old, that is selection bias. And to remove this, the best method is randomization. Randomization means they will come and they will choose chit. Those who choose chit A will go to A, those who choose chit B go to B. So in this way, young and old will get mixed. Randomization is best, but if they have this option, stratified randomization, that will be the best option. Stratified randomization, what does it mean? Stratification means layer. So you created a layer that I will choose 5 students of 20 to 22 year here, 5 of 20 to 22 year here. You created a layer that only 20 to 22 year student now will choose chit. So strata matlab layer. You created layer 20 to 22 year. Now you ask those 10, 20 to 22 year to choose chit. So now they are first stratified, now they are choosing randomly. So that will be the better answer if it is in the option. But out of stratification, randomization, which is best? Randomization is best. आप समझ रहे हो कि नहीं? आपने 10 लोगों को पहले ही चूज कर लिया कि वो 20 से 22 साल के होने चाहिए. You already decided that those 10 should be 20 to 22. Now you divide them randomly. So that is stratified randomization. That is better than plain randomization. But in out of these 4, best to remove selection bias is randomization. And do remember one more line that blinding, if you make the researcher unaware that which group are getting drug, which group are getting placebo, that's double or triple blinding. Blinding remove bias. Which bias? Researcher bias. It prevents us from manipulating data, but does not remove confounder. It do not remove the external factor which is disturbing the result. For example, in the above example, you are giving new drug to young people, placebo to old. So this young age is confounder, because confounder is one which is related to both exposure and outcome. Young age is related to new drug, young age is related to more weight loss. So it is external factor which is unequal. You can see confounder is unequal. In one group it is young, one group old. So confounder is always unequal. If you choose both young, confounder become equal, then there is no effect of confounder. So confounder is always unequal, and confounder is related to both exposure and outcome. It is related to both exposure and outcome. So if you want to remove confounder, blinding will not help, because let's say I am blind, I don't know which group is getting new drug, which group is getting placebo. Even then, even if I am blind, I don't know which group is getting young new drug, which group is getting placebo. If I am giving new drug to young, young will have more chance of weight loss. So even if I am blind, the confounder or effect of young age is not gone away. So blinding remove researcher bias but does not remove confounder. Do remember these 2 points more about confounder that they ask sometime, and then the question from confounder you can do very easily. DAS diet. DAS diet is the diet given for decreasing hypertension and cardiovascular disease patient, we give it. Of course, DAS diet should not have, they have asking except. So DAS diet should have less sodium. What is the dose of sodium which is allowed in human food, the sodium which is allowed is 5 gram per day. It should be less than or equal to 5 gram per day. And nowadays guidelines are saying sugars should also be less than 5 gram per day. So do remember, they again and ask sodium less than 5 gram per day in a DASH diet. And we ask them to do 30 minutes of brisk walking for 5 days a week. Okay, so that's there. Now let's come to this 2022 question. Which color bag blood bag goes? Blood bag goes in yellow. Which color urine bag goes? Urine bag goes in red. Lal mein peela, peele mein lal. Red color blood goes in yellow. Yellow color sussu, urine, goes in red. Okay. Now identify this image. I want to discuss 3 controversial things here. First, which has been asked also, needle with fixed syringe. So it is fixed syringe, still it will go in white. In white only 4 things go. Needle with fixed syringe, all kind of needle, all kind of blade, and scalpel, ustura. These 4 things only goes in white. So needle with fixed syringe, white. Where will you throw broken vaccine vial? Can you answer it? Broken vaccine vial. Yellow or blue or red or white? Do answer. Broken vaccine vial. See, if they give the option broken vial of cytotoxic drug, then answer will be yellow. But vaccine is not cytotoxic. Therefore, all the glasses and instrument, they go in blue. It will also go in blue. Very good. Most of you gave it correct. And your answer is coming very rapidly. I'm enjoying it. Now, where will you throw culture plate? And where will you throw culture medium? So remember, culture plate and medium, both will go in yellow. It is written in PARC that all the microbiological discs will also go in yellow. So plate look like go in blue, but no blue, but it will go in yellow. Let's do 4 more questions here. Where will you throw the cotton? Cotton is, of course, soiled waste, dirty waste, it will go in yellow. Where will you throw the contaminated gloves? So whether gloves is contaminated or not, all gloves contaminated or not, it will only goes in red color. So all gloves red color. Where will you throw the wrapper of plastic syringe? All the question has been asked in PYQ, so very important. Wrapper of plastic syringe. See, you are removing the wrapper before taking blood sample. So this wrapper is without any blood. It is not contaminated. So it will be a garbage, and garbage goes in black color. So wrapper of plastic syringe, black. Okay. Now coming to the next question. Identify this image over here. Do remember one short thing. If you will remember the yellow category, you can answer what all things are there. So for yellow, there are 6 things which should be on the tip of your tongue. Koi पूछे तो थूक की तरह निकलना चाहिए. It should come redly, like a sputum. Let's say I went outside after attending class and I have been crushed. So both my leg will go in yellow category. You will cut and throw it in yellow. Blood, so anatomical waste goes in yellow. Then the blood will come out from my thing means leg. It will also go in yellow. Then I will make the bed sheet dirty. It will also go in yellow. Then you will take my blood sample for microbiological culture, and also microbiological waste goes in yellow. Then any drug which is left or discarded, that will also go in yellow. And last but not the least, cytotoxic drug will also go in yellow. So this 6 thing will go in yellow. If you remember yellow, you can easily answer other thing. Do remember yellow separately. Which cycle they are showing here? That is the demographic transition model, which has 5 phases. High stationary, early expanding, late expanding, in which India belong, then low stationary, and then finally declining. So we probably will discuss it in next question, but remember this graph is of demographic transition model. And in this graph, 2 questions they can ask. Which phase has maximum growth rate? So you can say in the second phase, this part, the gap between birth rate and death rate is maximum, and birth rate minus death rate is the growth rate. So growth rate is maximum here. In late half of second phase, growth rate maximum. And where growth rate start decreasing? In early half of third phase, growth rate start decreasing. So do remember, growth rate is maximum in late half of second, start decreasing in early half of third. Which of the following does not work at village level? See, auxiliary nurse midwife ANM is same as health worker female, and health worker female is at sub center. Sub center is at 3,000 to 5,000 population. I hope you all know 3,000 in hilly area, 5,000 in plain area. And if the sub center is of type A, no delivery can occur. If the sub center is of type B, delivery can occur. And sub center is first point of contact where people can come for health. But these people are in a hospital. They are not roaming around in the village. But these three, Anganwadi worker, trained birth attendant and ASA, they are in the village. So do remember, ANM is at sub-center level. Okay. And I hope you all know that when they talk about MPW, multi-purpose worker, that is health worker male. So sometimes they can write health worker male as MPW. And this MPW or health worker male make malaria slide by which type of surveillance? Active surveillance. Active surveillance means they will roam around and they will search for hidden case of malaria. And do remember, in the malaria slide, in the recent INICT, they have asked that if you have to know the species, of malaria, which smear will be made, thick or thin. So species gametocyte can be appreciated in thin blood smear. So species is by thin blood smear. Thick blood smear only tell us whether malaria parasite is present or absent. And which committee talked about health worker, which committee is known as Committee on Multipurpose Worker? That is Kartar Singh Committee, which is known as Health Worker Committee or Multipurpose Worker Committee. Do remember active surveillance, malaria slide, by visiting every house in the village once in 14 days. They will visit every house and they will ask if anyone has fever in the house, घर में किसी को बुखार है क्या? And if anyone said yes, they will take 2 blood smear where thin will be for the species. Now in the species, they can give you image based question. If in the RBC image you saw granules inside, this is indicating Plasmodium vivax. If you saw granules, if they will give falciparum, in falciparum peripheral smear, there will be no granules, only banana shaped nucleus will be there. So granulated will be vivax, without granules will be falciparum. Next question, a 7-month-old infant was given measles vaccine during measles outbreak. When should the next vaccine will be given? No matter if you gave measles earlier or not, next is given at 9 months. Because till 9 months, measles vaccine is made inactive by the antibody in mother milk. मां के दूध में जो सिपाही हैं वो जो भी वैक्सीन दोगे उसको बेकार कर देंगे. So because mother milk will not let the measles vaccine work till 9 months, so we will repeat the dose at 9 months. Even if you give it early, we will give the second dose again at 9 months. And then third dose will be given between 16 to 24 months. Okay, so it is 9 months and it will be counted as first dose. Okay, we will ignore all the dose given early. Now, 30-year-old man arrives with major complaint of diarrhea, ascites, knee edema. His family consume mustard oil. We have discussed this topic already. Mustard oil will lead to epidemic dropsy. The poison will be sanguarine, S for sanguarine, S for sleeping. So sanguarine is the poison in which there is pitting edema. Knee edema is written here, you can see, but it is more leg edema, but anyway. And the poison is sanguarine. For mustard oil contaminated with seeds of Satyanasi, Argemone mexicana. Okay, that is the seed which mixed with mustard seed and cause the disease. In European country, birth rate is lower than the mortality rate. This is the condition of declining population. So declining will have negative growth rate. Okay. If more people are dying than taking birth, it's declining, negative. Now, in which of the following is the image? That is, today is the image of, it is vaginal sponge or diaphragm. And this vaginal sponge or diaphragm will have which chemical? it has nunnu jalinol, nunnu jan lele, and a diaphragm habit. And a lot of female students in this class, they think their menstrual bleeding pain is very big thing. But all the male in this class have suffered much bigger pain where when they are in the childhood, their nunnu got stuck in the chain. It is like nunnu jan lele, it's very lethal. And I remember my time, my whole family was there in around dining table, and I was kept there when my nunnu got stuck. And someone is saying, take it out, up, someone is taking down. My father came, suddenly pulled the chain, and I was relieved. But due to that trauma, post-traumatic stress disorder, PTSD, I was unable to wear any pant with chain till my 10th class. At 9th class, my mother came and said to me, ki, beta, your nunnu has grown up. Now it will not be caught. You can wear chain. I said, mother, if it is grown up, there is more chance of getting caught now. So that is the chemical nonozanilone. Do remember, if they are talking about levonorgestrel, do remember these two things. In the eye pill, there is not only 1.5 milligram levonorgestrel tablet, but also one tablet of 0.75 milligram. This 0.75 milligram tablet is given first tablet in 72 hours and second tablet after 12 hours of first tablet. So these two doses they have asked of eye pill. Okay, do remember. Now, which are the following, which level of prevention is if HIV patients are consulted and screened? Screening, what is the purpose of screening? Early diagnosis and treatment. And as we have discussed, all early diagnosis and treatment come under secondary level of prevention. So that will also be secondary level. There is one type of thing, stand-alone ICTC. Stand-alone ICTC have separate employee for HIV counseling and all. So if it is separate employee, they ask, where will you find separate employee for counseling? Answer is a stand-alone integrated counseling and testing center, which is example of secondary level of prevention. Next question, 4 to 8 speaker interact in form of a large group of audience to talk about a topic. There is no specific agenda, no set speech, no order of speaking. That is the answer which our friend who had given it earlier had given it correct. That is panel discussion. Symposium have fixed order of speech. If it is fixed order, it will become symposium. Workshop is used for training of ASA. They can ask this question. How will you give training of ASA, ANM? So in training of ASA and ANM, there will 4 to 6 session. In the morning, they will teach the theory. In the afternoon, they will ask you to do the practical. So this workshop can go for 2 to 3 days. And this is, they can ask training of ASA, ANM and all. Okay, and group discussion, we already discussed 6 to 12. And it is guided discussion, not open or closed, guided discussion. Next question, which statement is true regarding population pyramid? Population pyramid, we all know, is of two types. One is in which the base is big. If the base is big, broad base means more number of working population? No. Because broad base means more 0 to 5 year. Because it is every 5 year is the brick. So broad base denote fertility. You all must have seen it in animal movie also. When who was that actor, man, in animal movie? Husband of Ranbir Kapoor. He saw the broad base of the actress, and he said broad base indicate good fertility rate. So that is there, broad base, big fertility rate. And if you, this type of pyramid is for developing country like India and all. If you found this type of population pyramid, which is known as spindle-shaped population pyramid. Spindle shaped, spindle means bigger in between, tapering at the end. Beech mein mota, upar niche patla, that is a spindle shaped. Spindle shaped is for developed country. And they can ask, does population pyramid tell about only sex age distribution? No. It tell about age and sex both. If you divide it into male and female, it will tell about sex also along with age. Now some of you must be saying or thinking, sir, that animal movie is very objectifying female. But it's not that only male objectify female. Female also objectify male. So only someday back, my wife was seeing me from the back and saying, ki, baby, you have cute bum. So the objectification is both way, okay? Anyway, so do remember, big base for developing country, big center for developed country. Big base, more fertility, like that movie. Okay. Now, P1L1, para-1L1, female desire contraception for 3 years. If anyone want contraception after first delivery, the best answer will be copper T, which can, if it is copper T 380 Ag, it can protect for 10 years maximum. So best will be copper T after one delivery. After one delivery, if they ask the ideal contraceptive after one delivery, the best contraceptive, that will be IUCD. Similarly, they can ask ideal emergency contraceptive. So ideal emergency contraceptive or after one delivery ideal contraceptive. Both answer will be same IUCD. Because why IUCD is ideal contraceptive? Because this IUCD protect for 5 years, up to 5 days of unwanted sex, we can use it. So IUCD, up to 5 days of unwanted sex, we can use it. That's why it is the best contraceptive after first delivery or as emergency contraceptive also. More, they can ask what is the mechanism of action of IUCD. So the main mechanism of action of IUCD is spermicidal action. फेदे मर जाते हैं हमारे. Our sperm cannot tolerate the foreign environment, so they die. That is the best main mechanism of action of IUCD. Relative risk, attributable risk, population attributable risk, or are calculated in cohort ratio. Do remember, if they say incidence, if they say this word by or ratio of incidence in exposed by incidence in non-exposed, then answer is relative risk. They will say exposed compared by non-exposed or ratio of them. In these two cases, answer will be relative risk. If they ask which of the following is best indicator of strength of association, how strongly two things are related. So if they say best indicator of strength of association, again answer will be relative risk. If they say by or ratio, answer will be relative risk. Sometimes they can ask you to remember the formula of attributable risk and population attributable risk. In AR, we write incidence in exposed, we subtract non-exposed. So if they use the word subtract or minus, then exposed minus non-exposed, then answer is AR, divided by exposed, multiplied by 100, and whenever they use AR, they write the word due to. And like in cigarette packet, it is written smoking causes lung cancer. So when they say causes means they are saying lung cancer is due to smoking. Sorry for the cough. So in that, smoking causes lung cancer, what thing they are using? They are using attributable risk. When they say population attributable risk, is very simple. Wherever there is exposed, in place of exposed, write population. Population minus non-exposed by population, if they say, that is population attributable risk. And both AR and PAR, these are used by public health expert. People of epidemiology, they used AR, PAR. And who used RR? RR is used by clinician. Clinician use it. Now, out of AR and PAR, which one is better? So, better one is PAR, because PAR talks in a positive manner that if you stop smoking, this much lung cancer will decrease. Now, if you stop smoking cigarette, chance of lung cancer will decrease by 80%. So that is better way to tell people. So better is PAR because it talks in positive way. Do remember their formula also. Which of the following describe the relationship between social factor and disease causation? That is social pathology. Social factor, disease causation. For the past few years, Khesari Dal, if they will say directly, the answer will be neuroletharism. And this question first came in MCI, then they repeat it in NEET, that what is the treatment for neuroletharism? Vitamin C we can distribute in the villager and all, and we can prevent neuroletharism. So answer is vitamin C, and of course the poison is BOA, beta oxalyl aminoallyl. Do remember they are walking cross leg on toe in neuroletharism. A man lost both his hand while working on machine. As a result, he is unable to write and has lost his job. What is the name of condition of lost hand? See, DIDH is the sequence of event which occur. So you can remember the mnemonic DIDH, disease, impairment, disability, handicap. I want to see whether you can answer it correctly or not. Please do answer me this question, whether it is B or D. See, disease is the accident which happened in this class, in this example. Impairment means loss of body part. Loss of body part is impairment. So if they are asking about lost hand is always impairment. Very good, my friend. Sweta Sinha was correct. Prashant Derricks was correct. Alok was correct. Very good. Loss of body part is impairment, and more than 10 students has given wrong answer. So it was a good question to revise. Disability means unable to perform the function. Like if hand is lost, you are unable to do bathing, cleaning, a lot of work. And so function is lost, that is disability. And whenever they say lost job, not that job means the salaried job, then that is handicap. Okay, lost job word you found, handicap. So if they ask about lost his job, then answer will be handicap. If they say lost his hand, answer is impairment. Now let me ask you the question, where will you put hemiparesis? Hemiparesis will be which thing? Disease, impairment, disability, handicap. Please give me the answer. Where is hemiparesis will go? Yes, very good, correct, Nidhi. Loss of activity is disability, and Nidhi was the one who gave correct thing for panel discussion and in detail. Very good. So tell me, see, disease is stroke or heart attack, MI. Due to stroke, hemiparesis occurring. So hemiparesis is not loss of body but loss of weakness of half of body and all. So hemiparesis will also be impairment. Very good. It is not disability. You did it wrong, many of you. It is impairment. Disability is due to hemiparesis, patient can't walk. So unable to walk will be the disability. And due to that, the patient lost job, that will be the handicap. So see, it is a confusing concept now. Do remember, loss of body part or function, part is hemiparesis, but inability to do activity is disability. So this is question worth revising. Focus here. Now, Nidhi said impairment, I told. Yes, Nidhi, how can you be wrong? And Nidhi has a very accurate knowledge. I can appreciate that. Very good. Now come here. Which among the following is best describe the vaccine given to a baby at birth? Of course, I hope you all know that. BCG, OPV, Hep B. My question is, what is the dose of BCG which we give at birth? So dose at birth is now half, 0.05 ml, not 0.1 ml. And of course, it is given in left deltoid. So sometimes they can ask, what is the route of intradermally in left deltoid? What is the route and place where we give fractioned IPV? It's not fucked IPV, it's fractioned IPV. Because we in left we give BCG, and when we give BCG at 2, 4, 6 week, there will be abscess ulcer scar. So abscess ulcer scar 2, 4, 6, left side is busy. That's why FIPV is given intradermally at right deltoid. And FIPV is 0.1 ml. Now, question which they ask in NEET and they can ask again is, what is the route of giving JE and MR vaccine? See, JE and MR both are given by subcutaneous route, 0.5 ml. Which side you give JE, which side you give MR? M for mother. And mother love is always right. So MR is given on right arm, J is given on left arm. Both are given subcutaneously. Because in India, we are not using the killed strain. Killed strain is Nakayama, which is Nakamyab, no more in use. The strain which we use is SA14 2 bar. And SA14 2. So this is the live strain which we use, and it is given subcutaneously in left arm. Now, one more thing they can ask is the diluent. With BCG, the diluent is normal saline. As soon as the child is born, we want to make the life a bit salty. पैदा होते ही जिंदगी थोड़ी नमकीन बनाते हैं, तो BCG के साथ normal saline. With MR, the diluent is sterile water, because again the same concept. M for MR, M for mother love, and you know now mother love is like sterile water, it is still water. So MR, the diluent is distilled or sterile water. And no matter how angry is your mother with you, just press her leg for 10 minutes, she will melt like ice cream. And so that's why mother love is sterile water, MR. And if you write JE, in writing itself, you will write J and P also Japanese. So JE have phosphate buffer solution as diluent. So do remember this diluent and route. They ask again and again. One more thing they can ask is which vaccine is given by intranasal drop. So influenza live vaccine is given by intranasal drop. Okay. Now there is one more vaccine which is given by intranasal drop, that is Incovac. Incovac is COVID vaccine developed by Covaxin only. That is also given by intranasal drop. Do remember these mnemonics. And very important question of vaccination. At what age the first dose of hepatitis B is given? It is given at birth. Of course, we all know that. So birth is for hepatitis B. Now, best and hepatitis B, all other vaccines are usually given 0.5 ml IM. Now, best measure of central tendency of skewed data, too high and too low. See, remember this thing, median beach ka hai. Median is not affected by high and low thing. So if it is a data which has too many high, too many low, what is the best thing you will use? Median. Because it is not affected by big and low thing. Okay, chalo. Now, similarly, they ask in positive skewed curve, which one is greatest? Mean is greatest, you have to remember. The sequence of event in positive skewed is mean, or beach mein kaun aayega? Who will be in the center? Median. So median is always in the center and then mode. So if you remember this line, mean is greatest in positive skewed curve, you can easily answer that what is greatest in negative skewed curve. If mean is greatest in positive, in negative, which one will be greatest? Mode na, because median beach ka hai, median is in the center. So median can never be the greatest. Greatest will be the mode, then there will be median, then there will be mean. So do remember the sequence, very easy. Just remember this line, mean is greatest. You will remember the sequence. Next question, according to WHO, maternal death is antenatal and 6-week both. Not just delivery to 6-week, but antenatal and 6-week both are MMR, maternal death. Which parameter is used to compare life expectancy between two countries? Life expectancy can be compared by PQLI and HDI both. But HDI is life expectancy at birth. PQLI is life expectancy at 1 year. So if they ask only life expectancy, better answer will be HDI. How to remember this? Because it can be confusing under exam pressure. Very simple. When you write PQLI, LI can be written as L1 na. Life expectancy at 1 year is PQLI. And P is also for poor country. P for poor, HD for highly developed. So in highly developed country, we measure how many year you wasted, used in schooling. And so mean year of schooling is in HDI. And third thing which is in HDI is per capita income. But for poor country like India, we have infant mortality rate and we have literacy rate. Because literacy rate is for India. In UK, we no need of literacy rate. Bacha English bol raha hai. In UK, we will measure mean year of schooling. Even the child is speaking literate. So not literate, but at least speaking English and all. So mean year of schooling is for developed country. Literacy rate for poor country. IMR is for poor country. Why? They have asked it in NEET exam. What is the best indicator of accessibility and affordability of healthcare system? Accessibility and affordability of healthcare. What does it mean? Have you seen those video where mother is being carried on blanket or on some bed through river to hospital? So why such condition is there? Because in many tribal rural area, hospitals are not there. And that is accessibility. Accessibility मतलब कितने आसपास अस्पताल है कि नहीं, accessible है कि नहीं, is it there nearby to them or not? So if the hospital is not nearby, not accessible, more infant death will occur. So accessibility and affordability of healthcare system is best indicated by which indicator? IMR. NEET 2023 question. So do remember it. Second thing, IMR is the best indicator of impact of ASA work also. If ASA is working, then infant death will be less. So impact of ASA work and accessibility, affordability, both by IMR. Do remember? And do remember, PQLI has range 0 to 100. HDI has range 0 to 1. So how to avoid the confusion? HDI is small, So life expectancy is also small when birth, and range is also small, 0 to 1. PQLI is 4 letters, so bigger. So life expectancy is also 1 year, and range is also bigger, 0 to 100. Okay, so that's there. Do remember this. This is a very important thing which we discussed just now. Which of the following specialty do not provide at CHC? At CHC, we have surgeon, we have blood storage facility. CHC is the first referral unit, but intensive neonatal unit is not there at CHC. This is at district hospital. Okay, and do remember this question has been also asked. First referral unit, that is CHC. People went camping for a week. Best method, what you can do? Will you do composting, dumping, burial, manure pit? What is the best thing you will do? So if you will dump it, it will pollute. Composting need preparation. It cannot be done in 1 week. Manure pit again cannot be made in 1 week. It need more preparation. So you will do burial. Which type of latrine you will use? Deep trench latrine you will use. If there is 10,000 population, how much area you will dig? 1 acre you will dig. Okay. Which nutrient is not present in breast milk? We have discussed it again and again. Vitamin K not present in breast milk. Now, a 40-year-old female with no comorbidity complain of swelling in both her leg. As soon as they say swelling in both her leg, swelling in both leg, it means either it is wet beriberi by vitamin B1 deficiency. And which enzyme is deficient leading to wet beriberi? Wet beriberi occur by eating polished rice. The enzyme is thymine transketolase. And these are NEET 2023 question. Transketolase enzyme deficiency lead to wet beriberi and swelling of leg. Second reason of swelling can be sanguarine, which we just discussed, epidemic dropsy. So let's now just jump on the option. If anyone is in the option, that is the answer. Epidemic dropsy, poison is sanguarine. So answer will be sanguarine. Okay, anyway, there is mustard oil written. So answer will become sanguarine. If they have written polished rice in the same question, answer would have become thymine transketolase, vitamin B1, wet beriberi. Okay. Next question. Which of the following biomedical waste is disposed in yellow bag, blood bag, gloves, red, SARP, white, urine bag, red? There. Which among the following can be used to treat khesari dal toxicity? Vitamin C we have already done. Which of the following statement is true regarding 5th stage of demographic cycle? In 5th stage, we have declining population. And declining means the birth rate fall below death rate. That is declining. And less people take birth, more die. Answer is D. All of the following are true regarding urban primary health center staff except which are not present in urban PHC. In urban PHC, we are posting 2 doctors, one MBBS doctor and one Ayush doctor. Anyway, at any PHC, we are posting 2 doctors, MBBS and Ayush. So 2 doctor is correct. 2 staff nurse, this is wrong. At PHC, there are 2 type of PHC, of course, type A and B. Type A is when they are 19 delivery or less. And this question has also been asked in MCI. 19 or less, type A. Type B is more than or equal to 20 delivery. In type A, there are 3 nurses. In type B, there are 4 nurses. So definitely 2 nurse is wrong. 1 lab technician and 1 pharmacist is there. So lab technician, pharmacist is at how much population they asked? Minimum it is at 20 to 30,000 population. Because we all know in hilly area, at 20,000 population, there is 1 PHC. In plain area, 30,000 population, there is 1 PHC. So lab technician, pharmacist is at 20 to 30,000 population. Okay, type A, type B also remember. Remember, there are 3 to 4 nurses, not 2 nurses. And 2 doctors are there. Which population pyramid it is? It is triangular pyramidal. So it means it is the population pyramid of developing with big base, more fertility rate. You can see that. Now, this is showing which thing? This is showing us Bitot spot. Bitot spot is used for screening of vitamin A deficiency is done by Bitot spot. And 1A is conjunctival girosis. They can ask this question, what is the first symptom of vitamin A deficiency? If they ask first sign, sign is something which patient see. First sign is something which doctors see in patient, that is sign. Symptom is which patient come and tell us, that is symptom. So first sign is conjunctival girosis, है ना. इसको ऐसा कहते हैं, ऐसा लगता है जैसे सागर की लहरों पर रेत की परत हो, है ना. Sand on tide appearance. Why they call it sand on tide? This question has also been asked. Vitamin A deficiency lead to which thing? It lead to xerophthalmia. This was the PYQ. Xerophthalmia means dry eye. So their secretion of tear is less, eye is dry. That's why dust particle can come and deposit in the eye. So there will be some tear, some dust, some tear, some dust. It will look like sand on tide. So this sand on tide, conjunctival girosis is first sign. First sign is not night blindness. Night blindness is first symptom. First symptom is night blindness. Patient come and tell about it, that is night blindness. And when night blindness occurs, retina has already been dried. So we cannot use night blindness for screening. Night blindness is the first symptom. Screening is by bite spot. So 1A is conjunctival girosis, 1B is bite spot. Now, one more question has came from it in the recent MCA exam, that for if you are surveying school children of less than 6 years in any population, and night blindness is more than 1%, or bite spot is more than 0.5%, it means vitamin A deficiency is a common problem in that area, and we will give vitamin A to all the children of those area. So now how to remember this confusing data 0.5 and 1? See, I told you night blindness is the symptom, patient come and tell about it by themselves. So night blindness is more easy to find 1%. Bite spot is something which you go and search, screen. So bite spot is difficult to find. That's why bite spot is less 0.5 and night blindness is more 1%. Okay, do remember night blindness more because patient come report, bite spot less because you have to find 0.5. So in this way you can do that difficult question, and this type 4 question are there in this question again. First contact of people seeking medical care in community is definitely sub-center, is the first contact. But if they ask first person in contact, first point of contact if they ask, sub-center. First person in contact if they ask, that will be ASA. Yes, very good, correct answer. Now, Mayank Arora is asking, sir, perinatal mortality, is it taken from 22-week till birth or 28-week till birth? So he is asking the definition of stillbirth actually. So do remember, when we talk about stillbirth, the stillbirth is 22-week period of gestation till birth. Till birth. If you add 22-week till birth, any child die, that is stillbirth. And the weight of stillbirth is usually more than 1 kg. If you add stillbirth plus death in first 7 days and divide this with total live birth and multiply with 1000, this will become perinatal mortality rate. Peri का मतलब होता है चारों ओर, around the birth. Natal means delivery, birth. Peri means around the birth. So perinatal is 22-week till delivery and then first 7 days divided by live birth into 1000. That is perinatal mortality rate. Okay, very good. Thank you for asking such question. Keep asking your doubt. If you have any doubt in PSM, feel free to ask it right now in the box. Now, what is correct for sub-center? Urban, no, just PHC except. One PHC 30,000 in plain, correct. Type A PHC less than 20 delivery, correct. Provide maternal child health care, family planning, correct. But is it the first referral unit? No, 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 no. First referral unit is CHC. So not correct is option D. Which of the following is most common cause of macrocytic anemia? I have searched this question again and again. Most common cause is vitamin B12 deficiency, is most common cause. But if you ask most common cause of vitamin B12 deficiency, then answer can be alcoholism. Second answer will be vegetarian diet. And if you get a history of vegetarian diet and patient are walking with difficulty walking, they are pointing about subacute combined degeneration of cord, SACD. So vegetarian diet, difficulty walking, SACD. And macrocytic anemia, most common cause is definitely vitamin B12 or folic acid deficiency. But most common cause of vitamin B12 deficiency, if they ask, then the answer will be alcoholism. Okay, because vitamin B12 deficiency can also occur in hypothyroidism, can also occur in vegetarian diet. So correct answer will be vitamin B12, but if they ask most common cause of vitamin B12 deficiency, then answer will be alcoholism. Okay, alcohol. Now, hand washing awareness sensation was conducted. What is the correct sequence of event? First, we will try to build awareness. Then we will try to develop interest. Then we will see whether they adopted it or not. No. Then they will evaluate and then they will adopt. See, main confusion is in adoption and evaluation. Evaluation means they will evaluate advantage of hand washing, whether hand washing is a good thing or not, advantage or risk, and then they will took it. So this is the sequence correct. First they will evaluate, then they will accept the habit. Adoption means acceptance. So acceptance is after evaluation. There was also a question on health belief model. Okay, in health belief model also there are 5 things which occur. First is SS. In the center there is motivation, and then there is BB. First they will think what is the severity of the illness, if the illness occur will we die or not. Then they will accept if it is susceptible or not, can we acquire infection or not. Like in COVID, all the rural area, they were not taking it because first they were thinking it is not serious thing, just cold and cough. Then they were thinking that only urban people will develop, it will not occur in rural area. So they were checking for susceptible, whether it will occur in us or not. Then finally government of India motivated them that you should take it and all. So then they to first check the barrier. Main barrier is that it was in city hospital, not in village. So government provided it in PHC, also removed the barrier. Then they were finding out the benefit which is there of taking it, that it will also prevent a spread of COVID in other people. So they have asked this question in INICT, where the central area was filling the blanks. It is motivation which is in the center area. Okay. Now a 35-year-old male is unemployed because he is unable to walk. Unable to walk. But what they are asking? They are asking unemployment, lost job. Whenever there is lost job, it is definitely handicap. Unable to walk, where will you put unable to walk? That is my question to all of you. How will you place unable to walk? Is it impairment or disability or disease? Unable to walk means loss of function, not able to do something. And not able to do something, that is disability. So unable to walk is disability. The disease, let's say the disease was the polio. And polio lead to disfigurement of leg, that was impairment. Unable to walk is disability, and lost job is handicap. Okay, we have already done this question. During a measles epidemic in the country, 6-month-old child is vaccinated. So when you will do the second dose, given second dose at 9 months, you can say it is you have to give it the second dose at 9 months. Even if it is given at 6 months, you will not delay it. You will give the second dose at 9 months and then the third dose between 16 to 24. But you will count this second dose at first dose. The best way to plot trend in incidence, trend, whenever they use the word trend, all trend are represented by line diagram. So answer is line graph, simple. The major contributor of demographic burden, very good question. This is a question, it's a good question. You are a good question. Let's understand demographic burden. What is that? Demographic burden means more people are dependent. So demographic burden simply means increase dependency ratio. This is demographic burden. And what is demographic bonus? Bonus is a good news. So when they say demographic bonus, sometimes they will not say bonus, they will say dividend. Demographic bonus or dividend, these are good news. It means decreased dependency ratio. So I want to see the answer for this question. Most of you are saying either B or D. B or D. So bonus is decreased dependency ratio and burden is increased. What is dependency ratio? Dependency ratio means population less than 15 years are dependent plus population more than 65 are also dependent. And whom they are dependent on? Dependent on earning population between 16 to 64 year. And we multiplied by 100. This is dependency ratio. So now the question they are asking is how you will increase dependency ratio. So to increase dependency ratio, one thing we can do is increase producing children more. Increase dependency ratio by increasing fertility rate. If you produce more children, more demographic burden will be there. So how will you, if you decrease old age, decreasing old age, this is old age. If you decrease old age, dependency ratio will decrease. It's not a burden. Increase young age. Young age is called 16 to 64. This is young age. If you increase young age, denominator will increase, dependency ratio will decrease now. So if you increase young earning population, that's a good news. Decrease young age dependency ratio, increase old age dependency ratios. This is quite directly pointing that if you increase old age, dependency ratio increase and our burden will increase. So D is definitely correct. Okay. Now the question they can sometime also ask from here is how can you get demographic bonus? So demographic bonus is by decreasing dependency ratio. And how will you decrease dependency ratio? By decreasing fertility. So if you stop producing children, fertility is less, both things decrease, we will get demographic bonus. D for bonus or dividend. And when will you get the burden? When old age is more or fertility is high, then the burden is there. Okay. So do remember this question. I hope you understand it with the formula. If not, let me know in the box if it is not clear to you. Next question. Blood spill on operation theatre is cleaned with chlorine compound, which is 1% sodium hypochlorite. But in WHO guideline, it's 0.5%, but in Indian guideline, 1%. 8-week pregnant woman working in an industry consultant doctor, according to SI Act, which is the duration of maternity leave? 26 week, not 28 week. 26 week, starting from 8 week before delivery, we take it. Usually, 2 months before delivery, we start it. In the following is a first line anti-tubercular drug prescribed in initial 2 months. Initial 2 months is intensive phase. Intensive phase, we give HRZE. After this, we give continuation phase. In continuation phase, India give HRE, 3 things. So, which is in the intensive phase? Out of HRZE, E is in the option ethambutol. Linezolid is used for MDR TB. Linezolid prevent cell wall formation. It inhibits mycolic acid formation. Similarly, they can ask what is the role of bedaquiline. Remember this thing, bedaquiline and linezolid both are used for MDR TB. They can ask you the definition of multiple drug resistance TB. MDR TB means there should be resistance to both isoniazid and rifampicin. Both resistance is MDR. At least to both. कम से कम isoniazid, rifampicin दोनों काम नहीं करना चाहिए. Then MDR. How does bedaquiline work? Bedaquiline prevent ATP synthetase activity. And when there is no synthesis of ATP, then the bacteria will die in lack of energy. So this is mechanism of action they can ask. The process of in the oxidation pond is, in the morning time they can get oxygen, so aerobic. In the night time they cannot, so anaerobic during night. Next question, which of the following is true regarding single exposure point source? Single exposure point source start quickly, fall quickly, and the main thing is the time within which almost all cases occur is within one incubation period. Almost all case in one incubation period. If cases are occurring within one incubation period, then we call it as point source. So point source is always explosive in nature. They can change the question and they can ask food poisoning in boys hostel or Bhopal gas tragedy are usually example of point source. Not always. They are of point source only if all cases are within one incubation period. Okay. Sickness absenteeism of worker is used to evaluate what? People are not coming. So it is just telling us that health of the worker is not good, na? Sickness absenteeism of worker in the industry is used to evaluate health of the worker. That's why before taking people, we do the health checkup and then we place people. Okay. Now, incisors of a child who had white patches on them, later turn brown. They can give you image-based question also. White color plaque, they will say that is excess fluorine. And this hyperfluorination or fluorine normal concentration, they have asked in one of the MCA exam, that is 0.5 to 0.8. Chlorine normal is 0.5 to 0.7. So it's almost same, easy to remember. And if fluorine is too high, then to remove the extra fluorine, we use Nalgonda technique. In Nalgonda technique, the mnemonic is lab. We add lime first, then alum, then bleaching powder. It will remove extra fluorine. So mnemonic is lab. A study was conducted to compare MMR vaccine history children with autism and children without autism. So they are taking children with autism, no autism. Autism means disease. No autism means no disease. So when one group is disease present, one group is disease absent. Disease present absent answer become case control. And anyway, they are taking history. So it will become case control. Okay, but remember this thing, disease present absent case control, reason present absent cohort. In the urban area of Delhi, there is 4,000 population with different religion. Researcher is being done to study the dietary habit of population. Which technique we will use? See, the dietary habit depend on the religion. And whenever you divide the population, division means strata, layer. Answer is stratified random sampling. Strata का मतलब होता है layer. So we are creating layer, we are dividing. Let's say I have to choose 10 people for a party after the class. And I choose 5 boys, 5 girls, so that they can also have some setting while in the party and some love there. So if I divide you into boy, girl, then choose, that is stratified random sampling. So divide and choose is stratified. That's why stratified random sampling, they can ask this question also, is best for which type of population? Heterogeneous population. And simple random sampling is best for homogeneous population. Homogeneous simple, stratified heterogeneous. Systematic random sampling is when they say that every first house and fourth house selected, or every 7th student selected. So if every first and fourth house selected for interview, that is systematic random sampling. And cluster means we are choosing the whole village, not whole village, but children from the whole village. Like cluster random sampling is done in WHO immunization study, in which 7 children are taken from 30 villages. So that is cluster random, choosing the cluster group. Okay, first, fourth house systematic. Do remember this. Simple random is by lottery method. When the population is equal, homogeneous, then we do simple random. Next question is, surveyor visit household consisting 35 people who is 6 weeks pregnant, 3-year-old. Man, brother along with his wife is currently visiting them. This is a confusing question. Remember this. They are currently visiting, not living together. So if they are not living together, answer is nuclear. Extended and joint family in Park textbook, extended and joint family both are same thing written. Park is the standard textbook of PSM. Both are same in Park written. And joint and extended will be the answer if they are living together. And if let's say brother, my younger brother Golu, his family and my family are living together, then it is joint or extended, because now there are two married couple, two or more married couple with their family living together. That's joint or extended. And 3 generation is when my father is also staying, I am also staying, and my son Prithvi just born, he is also there. So 3 generation. But joint and extended are same thing, and they are only the answer if living together is there. If they are just coming for visiting, it's nuclear family. If living together, then we can call joint or extended. So answer is definitely nuclear. I have recently reconfirmed it through PARC when a discussion was started there. So do remember it, no doubt. Which of the following are not a component of RCH? RCH stands for reproductive and child health. So whatever is not related to reproductive and child health will not be under it. Women education and empowerment is not related with reproduction, or it is related with reproduction indirectly, but not directly. So it do not come under it. This education comes under Beti Bachao Beti Padhao, which is an awareness program, and it also come under Ministry of Education. So ideal per capita student space is 10 square feet. We have already discussed. Denominator of infant mortality rate is 1000 live birth. IMR means within 1 year, how many death occur per 1000 live birth. And do remember, IMR does not include perinatal mortality, because in perinatal mortality, we also have stillbirth. Death before birth is also there. So it does not include perinatal. Highest birth rate is seen in which phase? In high stationary, highest birth rate. So you can see this thing that again and again they are asking questions from demographic cycle. Do revise it before exam. High stationary have birth rate, death rate both high. Then second phase is early expanding. Early expanding have birth rate high, but death rate start decreasing. And this is birth rate, this is death rate. So this question came in recent MCI, which two phases have high birth rate? So you can see high birth rate is in both 1 and 2. These two phases have high birth rate. Then stage 3 is late expanding, in which India is also there, and late expanding birth rate start decreasing, and death rate it decreases further. Okay, and then India will go into low stationary, in which both birth rate and death rate will be low. And then after 15 year or 10 year maybe, India will go to declining, the 5th phase, in which birth rate become very low and death rate cannot be decreased after a time, so it will remain low. That's why declining have negative growth rate, and which was the question earlier. And which two phase has 0 growth rate? High and low stationary. They are stationary because their growth rate is 0. So in this cycle remembrance, only remember phase 2 and 3. More important. Early, late you should remember, because rest is very simple to remember. High stationary, low stationary, both thing high, both thing low. Declining, birth rate less than death rate. Only 2, 3 if you will remember the whole cycle. It's not so tough. Chalo. Now, during a vaccination drive, a male patient asking doctor to recommended vaccine can lead to impotency, especially with polio. This was the misconception that it can cause impotency. This is a type of cultural barrier. Okay, sorry for the cough. Cultural barrier, because in Aligarh, when we were doing MBBS, we were being asked to distribute polio, and this was the common misbelief that taking polio can cause impotency in the children. So it is culturally spread there that central government want to reduce Muslim population, so they are giving polio which is causing impotency. So to prove it wrong, some of us used to take it ourselves. And like I have taken many polio drops to prove it to them that it is not causing impotency. And ma kasam, it is still working, and it is not causing impotency. It was a wrong cultural misbelief. So there is cultural barrier. Okay, chalo. Now, a primary gravida deliver healthy baby, normal delivery. How many hours should she initiate breastfeeding? Within 1 hour. If it is C-section, we say 1 hour. If it is normal, within 1 hour. A pregnant woman with a but C-section, mostly they take around 4 hours to breastfeed. But anyway, we ask them to do as soon as possible in both the case. A 2-year-old child give a history of completing required antenatal vaccination during her previous pregnancy. Which of the following would you recommend for her current pregnancy? If the last pregnancy is within 3 years, we only give 1 dose of DT. And booster dose nowadays is of DT. If last pregnancy in 3 years, we give 1 dose. If in the question, rather than 2 years, they would have said 4 years, then the answer will be 2 dose of DT. If it is more than 3 years, 2 dose of DT. Less than 3 years, 1 dose of DT. Okay. A patient comes with history of category 3 dog bite. समझो कुत्ता आया मेरा बम नोच के ले गया, 3 degree dog bite. Received prophylaxis for a monkey bite 6 months back. So prophylaxis is taken within next 1 year, within 6 months back. So in this case, you need to do 2 dose, 0 and 3. But if the duration is more than 1 year, in more than 1 year, the vaccine are taken on day 0, 3, 7 and 28. So this is if it is more than 1 year last vaccine, and if it is within 1 year last vaccine, then 2 doses given 0, 3. Okay, so answer is B. Chalo, now, a government plan to outline tobacco control law. What is the level of prevention? Tobacco control law is there. It is both primordial and primary. There is no watertight compartment, but primordial is there when risk is absent. And here, tobacco control law, why it is given? Because there is a risk of cancer now. So risk is present. Then we are giving this law. That's why the better answer is primary. Okay. And in both of them, risk absent, risk present, but in both of them, disease is absent. So here, if it is any law, usually law comes under primary because there is a risk, then they give the law. Hand washing. When we do hand washing, when the risk of corona is there, so risk present, primary. Just like condom. Is any student is sitting in the class wearing a condom? No, na. Because there is no risk of HIV right now. You will not do sex while listening to my lecture, na. So you will wear condom when there is a risk of HIV, when you are doing sex only. So that's why primary prevention are condom, hand washing, mosquito net, minus desk, anemia mukt. Bharat is also primary level. Then all the vaccination are primary level, isolation, quarantine is primary level. Do remember all those examples. And all example of primary level are better written as a specific protection. If they ask condom is primary or specific, better answer will be specific protection. Okay, इसमें मेरे को एक जोक याद आ गया, थोड़ा मूड लाइट करने के लिए बताता हूँ. एक बार एक लड़का गया दुकान पे, बोला कि मेरे शहजादे की शेरवानी निकालो, bring out the gown for my prince. तो दुकानदार पूछा कि प्लेन निकालूं या जरी गोटे वाली, है ना? डू यू वांट प्लेन वन और वन विथ एम्ब्रॉयडरी, है ना? That's there. Now come here. School health services does not include which of the following? Education of handicapped children is included. Dental eye services is included. School health record is included, but there is no doctor which is being called in school health services. School health services is given by teacher. Teacher get 1 day training and do screening of children and do all these things. So there is no doctor on premises. I will show you in the cutoff in park shown below. Giving class in village for wound care after dog bite. Best way is demonstrate them how to do care by giving them the example. Infectivity is for secondary attack rate or serial interval. Serial interval means duration, time period of passage of infection from one person to another. Within how many time infection go from one person to another, that is serial interval. And secondary attack rate means number of people infected in second round of infection. How many people are infected in second round of infection divided by total population minus those who have the immunity minus those who are infected in first round into 100. So infectivity is included in definition of both serial interval and secondary attack rate. But if they ask this question, infectivity of disease is best indicated by, infectivity is best decided by or depicted by, best depicted by. So then the answer, better answer will be secondary attack rate. Secondary attack rate tell us that how quickly the infection is going to second round, infection is going to other people. But if they say time period of passing of infection from one to another, that is serial interval. And serial interval help us to detect incubation period. Help in detecting incubation period. Okay, incubation period is the duration of between entry and appearance of first symptom. मेरे अंदर कीड़ा घुसा और खांसी आई, फर्स्ट खांसी आई, इसका गैप इंक्यूबेशन पीरियड है. सो इंक्यूबेशन पीरियड we can never know, because we can never know when the pathogen entered. So how we detect incubation period? If let's say from me to you infection goes in 2 days, from you to other person it also goes in 2 days. So in 2 days it is going from one person to another. That is serial interval. How many days it take to pass from one person to another? And if everyone is passing it in 2 days, that means in me also the pathogen must have entered 2 days back. So that's why it will be serial interval will be telling us incubation period, and we cannot know when the pathogen entered, but we can guess it by serial interval. Okay. So now health propaganda we have already done. Health propaganda is something which appeal to emotion. Actively acquired is education, but something which make you emotional and make you do wrong things and all, that is propaganda. Don't be trapped of that. Be aware of propaganda, because propaganda is the best way to divide people and rule them. Now, how much % of GNP does WHO recommend? WHO is saying maximum we can give, but for India the guideline is saying that we need 2.5% GDP on health. And this is the table which I took. See, WHO saying there is no recommended level of spending maximum. But when it comes to India, then the WHO is saying 2.5% of GDP by 2025. So this is here. Eligible couple register, where will you put it? At sub-center, marriage and couple register sub-center. Birth, death, PHC. 8-month-old infant, how much vitamin? 1 lakh. Less than 1 year, 1 lakh. Less than 6 months, then answer will be 50,000. Okay. And if weight is less than 8 kg, I have discussed it, it will again become less than 1 lakh, or sorry, 1 lakh, no matter what is the age. Which vitamin deficiency cause dry eye, gerophthalmia? Vitamin A. Okay. They can ask what is the most common cause of blindness in children? So vitamin A deficiency is most common cause of childhood blindness. Okay, again a PYQ. The shelf life of copper T380 Ag is 10 years. And what is 380 here? They ask. 380 is the area of copper T, and this area is not in centimeter square, this is in millimeter square. Confidentiality is maintained when we are doing counseling, because it can be HIV counseling also. We maintain the secrecy. Now, which of the following is false about Ayushman Bharat? Setting up health and wellness center. As I said, sub-center and PHC will be changed into health and wellness center. And when they will open health and wellness center, they said they will give many new things. What are the new things they will give? Dental facility, ENT facility, mental health facility, old age treatment, palliative care they will give for cancer patient, and they will also give yoga, because yoga se hoga. So these are the extra thing that they are saying they will give at sub-center and PSC. Health insurance coverage not up to 10 lakhs. So this is wrong. Now you have to tell false. The health insurance is not 10 lakh, it is 5 lakh. And remember, it is not for BPL family, it is for economically weaker section family who are getting the insurance. So wrong statement is B. Okay. Now 6 into 6 strategy. First 6 are the people who will get benefit. Second 6 are the intervention which are there. And last 6 are the institutional mechanism. So they can ask what are the 6 intervention. First is iron folic acid. Third is deworming by albendazole. Third is behavior change communication, which we say solid body, smart mind. That is BCC, third benefit. Fourth benefit is we will have to do digital hemoglobin measurement and follow up. Fifth benefit is F and F, double F. First F is we will add folic acid and iron in the food, or we will try for that, food fortification. And last F is focus on other cause also. What are the other cause of anemia other than nutritional anemia? It can be malaria, filariasis, or sickle cell anemia and all. So these are the 6 benefits which are there. BCC is behavior change communication. ऐसी वाणी बोलिए मन का आपा खोए, औरन को शीतल करे आप हु शीतल से होए. So when we say solid body to a child, he will take it because he want to beat all the children of the colony. And when we say smart mind, then mother will take it thinking that their children will be smart and come first in the class. So by saying solid body and smart mind, we are changing their behavior. And this is also the logo of Anemia Mukt Bharat. So that is the third benefit. Do remember the 6 benefits which is or intervention which we give. So BII, beneficiary intervention, institutional mechanism are there. So what is not there? Coordination and ministry is not there. Now, what is the innermost square? Innermost number 9, innermost require tell adequately treated. At any population, half people have NCD, out of which only half get know about it, and those who know only half get treated, and those who are on treatment only half have adequate control. So this is adequate control D. The number of birth per 1000, if they add the word 1000, answer becomes general fertility rate. If they remove the word 1000 and only ask total birth per woman, answer will become TFR. So TFR is total birth per female. Okay, GFR is total birth per 1000 female, answer is C, GFR. When they use the word girl child, only then answer can be gross reproduction rate or net reproduction rate. But in net reproduction rate, they will say also use the word mortality. So if you saw the word girl and mortality, both answer is NRR. If you saw only word girl, answer is GRR. GRR is gross reproduction rate, which simply mean girl live birth per female. But not all children, girl child who are born survive till 15 years. So those who died, we will subtract their number and we will get NRR. So what is NRR? NRR is girl child per female between 15 to 49. But this time we will subtract those who died considering age specific mortality rate. So do remember this, that mortality word and girl NRR, girl GRR, and if they have used the word girl, then TFR and GFR can never be the answer. TFR and GFR will not have girl word in the thing. What is the target TFR of India? 2.1 is the target and we have achieved it. Okay, so that's there. Now, what is the dose of vitamin A needed in children age 1 to 5 year, coming to area with 1 to 5, so more than 1 they are saying 2 lakh international unit, not every 6 week, every 6 month. And a 2 lakh every 6 months till how much year? Till 5 year they will get it. Okay. Next question is, which among the following is not a part of urban health system? At urban health system, we don't have sub-center. That's why in Delhi we have Mohalla clinic, and in Tamil Nadu they opened Amma clinic. In a small population, we are writing 36 as 63. So if you change a small number with big, median remains same, but mean will increase. Median will be same, but mean will change. Mean is mean minded. छोटे दिमाग का है, जहां बड़ा नंबर देखता है उसकी ओर चला जाता है. Mean is mean minded. Wherever the number increases, mean will increase. It will go towards the big number, but median will remain in the center. Okay, so answer is B. That's why if they have given this distribution, let's say they have given 2, 3, 6, 9, 93. In this case, what thing you should use? We should not use mean because mean will be deviated. So median is better to use if there is a big number at the end. Which will we use? Median is used. Now, international agency that aid in construction of sanitary latrine and that also fund National Institute of Health Administration, that is POD. POD ke haga. ऐसा हागा कि लैट्रिन टूट गया, सैनिटरी लैट्रिन, और ऐसे हागेगा तो नहाना पड़ेगा ना. तो Ford is for sanitary latrine, and then knee high, National Institute of Health Administration by Ford. Do remember USAID fund malaria program that has been asked. Red Cross fund war victim relief. Care Foundation care for the nutrition of children, so it fund ICDS and Anganwadi program. Okay, these are by care. Then they can also ask you Rockefeller Foundation. Rockefeller is trying to make our foundation rock solid by funding research. So Rockefeller fund research and National Institute of Virology, because when we will do the research, then all the patent will be in our country and we will earn lakhs of rupees by making the patent. So Rockefeller fund National Institute of Virology. Also remember Colombo plan, CO for Colombo, CO for Cobalt Therapy Unit. Colombo plan fund Cobalt Therapy Unit, which is funded by Canada, and it also gave us fund to open AIMS New Delhi by taking fund from New Zealand. So these are the organizations which you should know and never forget. What is this diagram they are saying? Is it point source, common source, continuous, propagated, modern? How will you say? So this is continuous exposure. If it is propagated will have secondary wave of case. Now some of you can say that, sir, it is secondary wave. No, it's not secondary wave. Secondary wave will look something like this. That's why the answer given is wrong. The teacher also has gave the wrong answer. I will show you the real images below. This type of thing will be propagated. First one spike, then second spike. A very good example of propagated is COVID-19. COVID-19, you remember 20 less case, 21 high case. That type of thing is propagated. This is which has some fluctuation, is continuous. That is why continuation exposure is also known as intermittent exposure or multiple exposure, they say, call it. Multiple exposure or continuous exposure. A very good example is milkman distributing contaminated milk. So the source is common, but again and again he will be giving contaminated milk to villager. Again and again cases are increasing. So that is multiple exposure. Okay, this is propagated. I will show you the real images also at the end of the session for this. And if you want to see it quickly, I can go down, but it's better to show it at the end. Type A we have discussed. Less than 20 is type A. 12-year-old girl came for health checkup. She does not go to school. Who will help? The organization which will help is RBSK, Rashtriya Bal Swasthya Karyakram, in which we do the screening. But many students told us that in this question it was written that this 12-year girl is already diagnosed with malnutrition. So if she is diagnosed with malnutrition and don't go to school, in that case RBSK cannot help, because RBSK is doing screening and treating also, but there is no treatment of malnutrition. It's food which should be given for long duration. So in this case, which program will help? Help will come from ICDS program, Integrated Child Development Scheme, or Anganwadi will help such children, because she is already diagnosed with malnutrition. She does not need screening anymore. So if malnutrition is written, then correct answer will be ICDS. If not written, then answer will be RBSK. And do remember, RBSK do not screen for congenital glaucoma, and it also do not screen for zinc deficiency. Okay, because in this in RBSK, Ayush doctor is going there for the screening, and Ayush doctor is going without instrument. So all the disease which need instrument, they do not come under it. Although this question has been come that patient have dryness around nose and mouth. So if there is dryness around nose and mouth, it is indicating zinc deficiency. And sometimes they say poor wound healing. That is also zinc deficiency. But dryness around nose and mouth is only in 10% of patient, very rare to find. And I am sure none of you must have made a diagnosis of zinc deficiency ever. So zinc deficiency, congenital glaucoma don't come under RBSK. Don't come under RBSK. Okay. Do remember. And do remember these two questions. Poor wound healing, dryness around nose, mouth, zinc. Zinc deficiency lead to acrodermatitis, enteropathic. I hope you all know that is there. Newly diagnosed HIV patient present with fever, cough and hemoptysis. Which is the investigation of choice for TB? We will directly do CBNAT this time because it is out of those 5 cases. Identify the correct combination regarding disposal of expired drug. Expired drug goes in yellow bag, and in yellow bag we directly burn them, incineration. As per SDG, the target for MMR, not rate, it is ratio. Ratio target is less than 70 per lakh. Just remember 3 number, 70, 12, 25. 70 is the target for MMR, 12 is the target for neonatal mortality, and 25 is the target for under 5 mortality rate. So under 5, 25, 5 into 5, half of that 12, and MMR 70. These are the target of Sustainable Development Goal given in 2016 to be achieved by 2030. Okay, so that is there. Now, recommended daily protein intake for adult male weighing 50 kg, 55 kg. See, when they ask for RDA, RDA fulfill need of 97.5% population. When they say estimated average requirement fulfill need of 50% population. NEET and FMG both has asked it. First FMG asked, then NEET repeated this question. And when they ask RDA, we have to focus on reference male and female. We cannot give advice like, I am 90 kg, and you must have seen that ad by Akshay Kumar, who jump and say, whatever is your weight, eat 1 gram protein per day. If I took her advice clearly, my weight is 90, I will take 90 gram protein, then more organ will be hanging from my body now. So we don't give advice like that. How we give advice? Weight of reference male is 65 kg. Weight of reference female is 55 kg. So no matter which male or female I am saying, for everyone, protein we need is 0.83 gram per day. So we will multiply 65 with 0.83, and protein per day for male, every male in this listening to this class and all, it will come around 54 gram. And here for female, it will come around 46 gram. So you can roughly say what reference female is 55 kg, 10 minus 45 is the protein. All the female listening this class should take 45 gram female, 45 gram protein, not female. Whatever is your weight, you have to take 45 gram protein. And whatever is the weight of the male listening this class, you should take 55 gram protein. Answer will remain 55, whether it's 55 kg or 85 kg or 95 kg, answer will be same 55. Doesn't matter. So always remember, for male 55, female 45. It is for 97.5% population. If you are doing some exercise or athletic or some malnutrition is there, TB is there, then we can change the protein. But 97% population are like this. Then you should also remember their height. Height of male is 177, and if you subtract 15, 162 centimeter is the height of female. Then the age for which reference male female is taken 19 to 39 year, 19 to 39 year. And in India, the BMI for which we say normal is only till 22.9. After 22.9, you are pre-obese, and after 25, you are obese. Do remember, these are WHO Asian classification. Okay, chalo. Now, 30, very good question for tetanus. 30-year-old male came, he took TT at age of 23. Now again he had second injury, what to do? So remember, if the history is less than 5 years, in less than 5 years, no matter which wound is there, we will only wash. We will not give tetanus even if it is dirty wound. If history is less than 10 years, then we will give only DT or TT 1 dose. It doesn't matter which type of wound is there. So in this case, you can see this has crush injury. Crush injury means other type of wound, other wound. But it doesn't matter whether it is crush injury or clean injury. If it is 5 to 10 years, we always give DTTT. Answer will become single dose of tetanus toxoid B, which most of you gave answer. Very good, Dr. Prashant, Niti. Mukesh Meena, Medico Mukesh, Carpal Tunnel, Safi Imran is also giving the answer correct, B. Very good. So all of you are here, B. Now, if it is history is more than 10 years, now it depends which type of wound is there. If it is clean wound, less than 6 hour, non-penetrating, in this case, we will give again 1 DT or 1 TT, just simple, same thing which we were giving 5 to 10. But if it is any other wound, then along with 1 DT TT, we will also give tetanus immunoglobulin. Now, so the difference is only when it is more than 10 years. Less than 10 years, same for both. Wash up to 5 to 10, 1 DT TT. Now suppose someone has forgotten the history. So if someone has forgotten the history, no history given, then we will give 5 doses of tetanus. We will give ghapa ghap, ghapa ghap, ghapa ghap, so much vaccine that now the person will not forget ever. So forgot history, then only full course will be the answer. Full course. And full course means 5 doses of TT or DT. Okay. But because it is other wound, which can be dirty wound also, along with full course, we will add tetanus immunoglobulin. So remember this 3 point. Tetanus immunoglobulin only in case of other wound. Second point, if it is forgotten, only then full course. FF, double F. Forgotten, then full course. Third point, if it is 5 to 10 years, no matter which wound is there, both have 1 DTTT. So in that way, you can do such question very well. Okay. Now, suppose they ask 10 year. 10 year. Will you 10-year dirty wound? So if they say 10 year, answer, and this is the NEET question being asked 2 times. So this can come in your exam. 10-year dirty wound. 10-year back TT taken and patient is coming with dirty wound. What will you do? Till 10 year, we will give only 1 DT or TT. More than 10 year, we will add immunoglobulin. Not till 10 year. More than 10 year, we will include tetanus immunoglobulin. So it is dirty wound or clean wound. It doesn't matter. 10 year, if they gave only 1 DT, TT, no immunoglobulin. Okay, very important question. Do revise it. Which of the following carcinoma is least likely to be seen in patient in OCP? So OCP decreases inside cancer. What are inside cancer? Ovarian or endometrial? So endometrial cancer will not be seen. It will be less. Ovarian will also be less. O for OCP, O for outside cancer, breast and cervix increases. But inside cancer, endometrial and ovarian will decrease. Okay, so that's the B answer. 45-year-old HIV positive male present with 2 weeks of cough, fever and night sweat, CD4 count less than 100. Which following investigation most likely to be seen in him? See, if CD4 is less than 50, then 4 things can occur. One is Mycobacterium avium complex. In the real recall, it was less likely, not most likely, less likely was the real question. So if the real question, if you will go, it will be less likely. So if CD4 less than 40, only then Mycobacterium avium will occur. So Mycobacterium avium will not occur, less likely to occur if it is less than 100, because between 50 to 100, if anyone is there, 51 to 100, he will not develop Mycobacterium avium complex. 4 diseases will not be developed. What are the 4? MAC, then there is histoplasmosis. Then there is what? 2 more diseases are there. Can you? Lymphoma and infectious mono. 2 diseases with I is there. It's actually a medicine question. But anyway, let me try to remember it. Leukemia. lymphoma, infective lymphoma and leukemia, infective lymphoma and leukemia. I have this image which is below. I will show you the image that will clarify this doubt very well. Let me show you the image, and that will help me also because I have forgotten that two disease. See, this is the image. Let me make it bigger for you to better. If the CD4 count is less than 50, in less than 50, CMV retinitis, not infectious lymphoma, but CMV lymphoma and CMV retinitis, CMV retinitis, CNS lymphoma. Retinitis lymphoma, histoplasmosis, MAC will only occur if it is less than 50. So less than 50 will have these four. These four will not occur if it is between 51 to 100 or more than 50. These four will not occur. So what four will not occur if it is 100? If it is CD4 is 100, immunity is low, but if it is less than 50, immunity is very low. When it is very low, only then four diseases occur: Mycobacterium avium complex, histoplasmosis, retinitis, and lymphoma. So CMV retinitis and CNS lymphoma. So to remember this chart, the best way is, history is the old thing now. So history occur if it is less than 50. And TB is a very common. So TB occur if CD4 is more than 200. Tuberculosis here, histoplasmosis here. Apart from this, all OSIS are between 50 to 200. You can see in 50 to 200 there are only OSIS: pneumocystosis, toxoplasmosis, cryptococcosis, coccoidomycosis, cryptosporidiosis. So all OSIS are between 50 to 200. If it is less than 50, then fourth thing: disseminated MAC, histoplasmosis, CMV retinitis, CNS lymphoma. Only one OSIS histo occur less than 50, and one OSIS tuberculosis when it is more than 200. All OSIS are between 50 to 200. So like that, you can remember this table, and it can help you in solving this medicine question. Okay, dear? Chalo. Now, yes, okay. Next question is, which of the following is not a part of a step approach? So in a step approach by WHO, we do 4 investigation. What are those 4 investigation? One of the students suggested me this mnemonic: BTR love, BTRL. 2 are from B. What are those 2 things? One is BP and other is body mass index. T stand for thyroid profile and R stand for random blood sugar, which is best done in pregnancy at 28 weeks. L stand for lipid profile. So these are the tests which we do in step surveillance. BTR love can make you remember the mnemonic. Now in one NEET they ask which factor is not included in step surveillance. So for that you can use the mnemonic bum pe haath. And there are 2 bum. So 2 bum. 2 bum pe haath. Dono bum pe haath. First B factor is behavioral. We will, if I want to know why we do step surveillance. Step surveillance is done to know high risk population for NCD. If you want to know in Brazil there is more high risk people for diabetes, or in India there is more high risk population for diabetes. So you don't know, suppose the answer. So you will choose 5,000 people from Brazil, 5,000 from India, and you will ask them the behavioral factor. And we all know behavioral can also be known as psychological. So we ask behavioral or psychological factor. Then we ask physical factor like BP, BMI and all. Then we ask biological or hormonal factor. Okay. So these 3 factors we ask: behavioral, psychological like diet, exercise, smoking, exercise and alcohol. Then physical, which is BMI, BP and age. Then hormonal or biological, in which we ask random blood sugar, thyroid profile, lipid profile. So we go stepwise. That's why it is a step approach. And which factor is not included in step surveillance? So do remember, therapeutic factor is not included. Although you can say that lipid profile and thyroid profile are therapeutic. We can start the treatment based on that. But the purpose is not to start treatment. The purpose is just to know that out of 5,000 people randomly chosen, how many are high risk for NCD, high risk for diabetes. So we are not starting treatment, that's why therapeutic factor not included. So which test is not done? Blood grouping is not done. We do BP, lipid profile, glucose level and thyroid profile, BTR love, but we don't do blood grouping. And which factor we don't ask? Therapeutic factor we don't ask. Do remember this is step surveillance question. They can ask it again in this exam. A 30-year-old male presented with complaint of bleeding gum. Of course, we will give vitamin C, because vitamin C help in collagen synthesis. Collagen synthesis defect lead to scurvy. This patient is having scurvy, and of course vitamin C, if they ask the richest source of vitamin C is Indian gooseberry, amla, not hasim amla but amla. Indian gooseberry richest source of vitamin C. Okay, chalo. Now coming to the last PYQ of 2024 January session, a syringe with needle will go in white. We have discussed it already. Anmol topic image was given. In Anmol there will be green mother and green child. And see, if they give you logo of mother and child, it can be 6 program. Mother and child logo green, it is Anmol. Anmol is tablet program for ANM for data reporting and follow up. Okay. Second thing, if they give you green color logo, it is Anmol. If they give you blue color logo, it is UNICEF. And UNICEF also funds seed and manure of applied nutrition program along with maternal and child health. It funds seed and manure of applied nutrition program. Remember, seed manure, UNICEF. Third is the yellow color logo. Yellow color mother child, yellow is due to Susu. So Janani Sisu Suraksha Yojana or Karikram. And in which 3 free thing is given: free ambulance, free treatment, free investigation, and free food for 3 day in normal delivery, 7 day in C-section. So 3 colors then. Then if they give you white mother, white child means foreigner, it is baby friendly hospital initiative. If they give you black mother, black child, that is Laksh program. And do remember, Lux program is for improvement of facility in labor room and maternity ward. Labor room, maternity ward. Okay. Then, if they have 6th incomplete mother and child, that is for an incomplete program which is not implemented, just launch. Incomplete mother and child program name is Pradhan Mantri Matru. Matru means mother. Vandana means worship program, in which 6,000 rupees is given. Previously it was 5,000, now they increased it to 6,000. 2,000 at 12 weeks when she come for registration, next 2,000 at 6 months, and last 2,000 at 6 weeks after delivery when she come for vaccination first dose. So these are the 6 with mother child. I hope this color will help you in remembering it. 1,000 people are in a village. Mortality rate is 6. Country death is 3. What is the SMR, standard mortality rate? See, the formula for standard mortality rate is observed death, because they sometimes ask the formula, so I am telling it to you. Observed death by expected death into 100. What we observed in the village? We observed that the death is 6. What is expected? Expected is the country death 3. So 6 by 3 into 100 you will do, it will come 200, not 2. 2 into 100, 200. So you just need to remember this formula of SMR. It is for indirect standardization. We use this formula. Now, most common childhood blindness, vitamin A deficiency. A baby is lethargic after pinching, skin retracts slowly. And she is lethargic but eagerly drinking water. If eagerly drinking water, it means he is having moderate malnutrition, because skin pinch is going slowly. So there is some, moderate dehydration. Moderate dehydration is not an emergency. If it is severe dehydration, we go in pink and refer the child. Moderate is yellow. So here it is yellow. If eagerly drink water is not given, it is given child is non-responsive, not drinking water, then answer will be pink. And if they would say child is drinking water, skin pinch, go quickly, then answer is green. Green means no dehydration. No dehydration. Moderate is yellow and severe is pink. Now, demographic transition model we have discussed. Birth rate same in both phase. Same in both phase means high birth rate. Oh, very confusing question. Same in both rate means high birth rate is in two phases. Which two phase? Same in both phase. High birth rate is in phase 1 and 2. And same birth rate, same death rate they are asking. High birth rate and high death rate. Same birth rate, same death rate if they ask. Answer is phase 1. High birth rate, high death rate, phase 1. But if they say low birth rate and low death rate, answer will become phase 4. So it's not a good recall. Sorry for that. And that's what I got in the recall and it's not a good one. But if they say high birth rate, high death rate, phase 1. Low birth rate, low death rate, phase 4. In 1 and 2 phase, in these two phase, both have high birth rate. If they say which two phase has high birth rate, because a lot of students told me the real question asked which two phase have high birth rate. So 1 and 2 have high birth rate. Which stage birth rate is same but death rate changes? So birth rate changes, it cannot be high stationary, cannot be low stationary. Birth rate changes, death rate changes, birth rate is same. Same means birth rate is high. High birth rate, death rate start decreasing. This is the characteristic of early expanding. Because in late expanding, birth rate is not same, birth rate start decreasing. So, and death rate decreases further. So, I told you again and again, do remember phase 2 and 3 clearly. Early expanding is 2, late expanding is 3. Please go there in the exam after revising this topic and the topic of demographic indicator. And very frequently they ask questions from here. So, birth rate is same. Same means high. Death rate decreasing, that is phase 2. Now, method for fecal disposal, best method for fecal disposal in a camp. In a camp, that was the real recall, that is deep trench, which is best method. Patient who have decreased iron level was taking medicine, which following food item decreases absorption of iron. Tea, milk, they decreases absorption of iron, and citrus fruit like amla and lemon, they will increase absorption. So tea, milk and all calcium tablet, they will decrease it. And of course, because when it is ascorbic acid, citric environment, Fe2 plus turn into Fe3 plus and absorption occur very fast. So that's why we ask mother to take iron tablet with lemon water, milk tablet after food, and there should be a gap of 3 hours between iron and calcium. Correct order of family. First there is formation, then extension, then complete extension, contraction, complete contraction. Option A is correct, of course. Other option was not properly recalled here. So it is there, which is complete. You can see formation, extension, complete extension, it's D. Now, step followed in disaster management. The step is very simple to remember. First, there is impact. After impact, there is triple R. First, we try to do response and we try to rescue people. After response and rescue, we try to give them their job back. So this is rehabilitation, making them self-dependent. After we give them job, then only we can construct their house, reconstruction. And these three is together called as recovery. So impact, then recovery. After this, we do mitigation. And in one exam, they ask what is the example of mitigation. So a very good example is like mitigation means decreasing impact of future disaster. So example can be attempt to make earthquake-proof houses. We cannot make it always earthquake-proof, but we are trying earthquake-proof houses. So that will decrease effect of future earthquake. That is mitigation. After mitigation, we do preparedness. And whether you are prepared or not, there will be next impact. So this is the sequence of event. How will you remember it? To remember it, you can use the mnemonic triple R after doing the movie. they went to MP, Ujjain. And in Ujjain, Madhya Pradesh, and in Ujjain, MP, if you will come out from Mahakal temple and all, on the left side, you will find this bhang ghota type of shop. So they had this marijuana bhang. And after that, of course, there will be big impact. So MP, then there is impact. So do remember, triple R MP impact is the sequel, and it's quite logical to understand risk. First we rescue, then we give them job, then we do construction. So the correct option will of course be response, rehabilitation, mitigation, and then impact can be there. Okay. But it start with, it's a circle. So both B and A can be correct. But better answer will be A because it is starting with impact. So impact, then response, rehabilitation, mitigation will be better. Okay. And mitigation do not come just after impact. So this is wrong. Rehabilitation, then mitigation, then impact. This is also wrong. So correct answer is, better answer is A. Very good. But B can also be correct because it is a circle. Better answer is A because it starts with impact. Now, pregnant women living in endemic area have Vivax. So in pregnancy, primaquine is contraindicated, not only in pregnancy, but also in infant, and it is also contraindicated in G6PD deficiency patient. So we cannot give primaquine. The correct answer in the option should be chloroquine. Chloroquine will be the correct one if given in the option. If not given, you can choose quinine. This is the second option, better option. Artesunate is again contraindicated in first trimester of pregnancy. We give artesunate as drug of choice in other area, but not in northeastern area for falciparum malaria. So artesunate is correct when it is not pregnant. Pregnantly written, so artesunate is gone. Ivermectin is not used for malaria. It is used for scabies, mass chemoprophylaxis and all, we can use it. So correct answer become quinine here, but it is second best answer. Chloroquine will be the best if in the option. Similarly, they sometimes say that a patient from Assam went to Delhi. What is the drug of choice? Drug of choice will be artemether and lumefantrine. The patient has Plasmodium falciparum infection there. So artemether and lumefantrine will be there. And they have asked what is the dose ratio of artemether lumefantrine. So the dose ratio is 1:6. So if artemether is, let's say 40 milligram, 6 times more, 240 is lumefantrine. 1:6 is the dose ratio. Similarly, they can change the option. They can say Delhi patient went to Delhi, patient went to Assam, or Delhi patient, a Delhi person went to Assam. So it doesn't matter who went to where. If they have written name of northeastern state, in northeastern, artemether is drug of choice. So always the answer will be artemether plus lumefantrine. Okay, both cases. Because artemether work all over India, but artesunate do not work in northeastern state. So if someone come from Assam to Delhi, they might have taken falciparum of Assam, which is not treated with artesunate. Answer will become artemether. And if someone went from Delhi to Assam, by going to Assam, he might have developed that falciparum on which artesunate will not work. But artemether will work on anyone. So the best answer is artemether plus lumefantrine, 1:6. There is a 2-month pregnant woman, OPD, Vivax infection, drug of choice. If they say, the same question is there, answer will be chloroquine. If she is not pregnant, then answer will be chloroquine plus primaquine for 14 days. Now, which of the following tests is routinely done for screening of cervical cancer in women? Of course, we do pap smear for cervical cancer screening. In cervical cancer, if you found the most common strain, if they ask, 16 and 18 is most common strain. And if you found E6, E7 subunit, this is the INICT question, E6, E6 subunit, it means there is high risk of cervical cancer. Okay, 2 things you have to remember. In Kerala region, viral outbreak occur. And what is the transmission which is occurring here? So Kerala region, anyway, they are talking fruit bat, it is Nipah virus. Answer is Nipah. Which among the following is not true for case control study? Case control is not cause to effect. Cause to effect is cohort, we have discussed. Start with karan goes to parinam. Start with reason goes to outcome. So answer is cohort. But do remember, if they ask correct for case control, first option, done for rare disease. Second option, cause to effect. Third option, effect to cause. Fourth option, prevalence study. What is the answer? We all know prevalence study is for cross-sectional study, gone. And cause to effect is cohort, that is also gone. Correct answer is, very good, Vishal Thakur, Alia, Divine, Ordinary, Trisul. All of you are right. Dr. Nigar Ansari is also right. C, effect to cause. Case control is easy to do for rare disease because we just have to take history, which can be done in one day. So it is easy to do for rare. But it's not that it is done only for rare disease. Easy to do for rare disease. But this line, done only for rare, is not correct. Done for rare is not correct. It can be done for common disease also. Easy to do is correct statement if it is in the option. And easy to do. Done for rare is wrong. So the correct answer will become effect to cause. Okay. Global hunger index include under 5 mortality rate, undernourished population, stunted population, but it does not include IMR. Infant mortality rate is not included in global hunger index, and IMR is not included in sustainable development goal target also. SDG also do not include IMR. Group discussion, as I have taken, is a guided discussion. It is not open, not closed. It is guided by group mentor. Navjat Shishu Suraksha Karikram focus on 4 things. It focus on prevention of infection and hypothermia. If you are able to prevent child from infection, hypothermia, then we will go for breastfeeding. So the third is exclusive breastfeeding. And if you are unable to save the child, then we need neonatal resuscitation. So simple to remember. They can ask it again and again. Which of the following is not a work of Navjat Shishu Suraksha Karikram? So what are the 4 things? Prevention of hypothermia and infection. If unable to prevent, succeed resuscitation. If prevented, breastfeeding. 4 things in NSSK. So NSSK, which is not included, lactating mother is included, neonatal infant mortality included, infant mortality included, but abortion is not included because NSSK focus in neonate first 7 days. So it cannot focus on abortions. Okay. It is for benefit of neonate, but the main question was, which is not a priority of NSSK, and you have to remember what are the 4 priority: prevention of infection, hypothermia, neonatal resuscitation, and exclusive breastfeeding. Now, a woman missed 2 OCP in the 3rd week of her cycle. What should you recommend for her case of action? This is a gynae question and a controversial one. I wrongly took it here. Please ask this question with gynae, ma'am. I don't want to touch any outside ball and go into cut. And this will decrease my reliability, so I cannot guess. I don't know this answer. Ask it from gynae. Next question. Nurse use syringe with needle. We have already done white. Triage, highest priority, red. Least priority, black. Survey conducted in district. Which define deficiency in that district? So, bite dot spot should be, I have discussed it already. Bite dot spot more than 0.5, then we need to distribute vitamin A in the whole area. Night blindness more than 1, then we need to distribute vitamin A in the whole area. Okay, so this is 0.5 and 1 for white dot spot, night blindness. Let's see this thing in detail. See, these are some of the repeated question only. Don't need to worry. We are almost done. Just 5 more minutes and the session will end. see, this is a table which I have taken from many pages I have taken from Park, which are from the topics which has been asked. Like this was one of the topic, they asked image of sling psychrometer. And what does sling psychrometer measure? They ask, it will measure humidity. Psychro word means humidity, so it will measure humidity. We'll come there. Let me show you this table, which I was willing to show you. Phew. Can you see it? Yes, you can. Now, night blindness, as I told you more than one night blindness. Bitot more than 0.5. And this is the part where they ask and confuse you. But other than that, if you want to know, corneal gerosis more than 0.01, corneal scar more than 0.05, and serum retinol less than 10 in more than 5%. Because serum retinol will decrease first, so it is more 5%. Night blindness is reported second, so it is second number 1%. Bitot spot will be seen, so 0.5. Okay, remember at least this much. Two more extra information is corneal gerosis 0.01, more than 0.01, and scar more than 0.05. Why? Corneal scar will be seen, so it is more 0.05. Gerosis we have to see, so less 0.01. Just like bitot spot we have to see, so less 0.5. Night blindness reported, so more 1%. Okay, like that you can remember the table. Now, let's coming back to our question, which is here. The question, this was the sling psychrometer. We already discussed it. What is this instrument? Sling psychrometer. And anywhere where psychro word is there, psychro means humidity. There is one more instrument, Ashwani psychrometer. Ashwani. And it looks exactly like proctoscope. It can give you this image type thing also, like a satellite which will go in someone's ass. So Ashwani psychrometer. Again, psychro if it is humidity. Okay. And kata thermometer is something which will be long. Then, and if they give you the image which is circular or oval, that is globe thermometer. Globe thermometer measure radiation temperature. They can ask in this exam about globe thermometer, which is radiation. You know, kata is long now because kata laga, hai laga, hai na? So kata must be long. Kata is thorn. Hai na? In Hindi, thorn is kata. So kata measure two things, cooling power of air and air velocity. है ना, एक शेर याद आ रहा है इसी बात पर कि खुली हवा के दिए कब के बुझ गए होते, कोई तो है जो हवाओं के पर उतरता है. So kata thermometer measure two things, cooling power and air velocity. Globe, radiation temperature. Ashman and sling, humidity. In sling psychrometer, there is wet bulb and dry bulb thermometer. This wet bulb and dry bulb, both are in sling psychrometer. So what they will measure? They will also measure humidity. Okay. This is a very famous question of our time. Wet bulb, dry bulb also measure humidity. Okay. So a survey was done of mental retardation. Some are having mental retardation. We are giving them training to perform better. This is known as positive eugenics. If you give good environment for better expression of gene, positive eugenics. Positive euthenics, sorry, very sorry. Euthenics. Both are eugenics option. I wrongly tick it. Let me correct it. I will explain this topic in detail to you, and there is a photo below also which will tell it. Euthenics. What is euthenics? Euthenics means better environment for better function, better expression of gene. Whatever gene this autistic child has got, we cannot change them, but we can make them better environment so that they perform better. That is euthenics. When it comes to positive eugenics, example of positive eugenics is artificial insemination. Let's say someone want to have child of Virat Kohli, so they can take his sperm and improve the genetics. That is eugenics. Negative eugenics means not allowing some people to reproduce, like what Hitler did. So Hitler did negative eugenics. Positive eugenics, artificial insemination. Positive euthenics means improving IQ by giving them better environment. One example is there, giving them better expression. In alcoholic patient, blood was dropped. What will you put? We will put in floor sodium hypochlorite, being asked 3 times. We will put it and wipe it. 1% in India, 0.5% in WHO guideline. In Anemia Mukt Bharat, what is the dose used in pregnancy? In pregnancy, we give it 60 and 500 once a day. But in case of pregnancy, if they say adult female, answer is 60 and 500 once a week. And if they say adult female or pregnant female and HB equal to 9, HB equal to 9 means they are calling the patient as anemic. So if there is anemic patient, for both of them, the treatment is same. 2 IFA tablet per day. And the dose of IFA tablet always remains same, 60 and 500. But if they say period of gestation is more than 34 weeks, HB is equal to 8. Now we don't have the time to give IFA tablet. So in this female, for treatment, we can give IV iron sucrose or IM ferric carboxymaltose. But do remember, when you give IV iron sucrose or ferric carboxymaltose, you will stop iron tablet because tablet is not given with injection. And in the same female, if let's say HB is less than 7, severe anemia, then we will directly, in pregnant female, then we will directly do blood transfusion. So for mild anemia, we give oral tablet. Moderate anemia coming very late, we give injection, stop tablet. And if it is severe anemia, we will do blood transfusion. Okay, so do remember the management. Please revise this part at least before going to exam. The treatment management in gynae, PSM, again and again they ask it. Soldier come from war, where best thing is deep trench. Deep trench is the best. Trench latrine or deep trench is the best for war or camp. Kala Azar reservoir is man. It can also be dog, but in India, the reservoir of Kala Azar leishmaniasis is man. Okay? India man, other country it can be dog also. Kerala region outbreak, we already have done this question, Nipah virus. 5-day intercourse, ideal contraceptive is IUCD. We have discussed this topic. Now, this is the question of maternal mortality ratio. We multiply it with 1 lakh and divide it how many live births are there. And we count maternal death in pregnancy until 42 days above. So how many maternal deaths? 2 by preeclampsia, 2 by PPH, 5 stillbirth. So stillbirth is not needed. Stillbirth is in this part. Live birth minus stillbirth you will do. That will be there. 4,000 live birth. So how many live birth? 4,000. Stillbirth has nothing to do with maternal death. And total maternal death they say is 10. So actually the data in recall is wrong. Originally what they said was 2 female preeclampsia, 2 PPH, 4 obstructed labor. Okay, I have not given it, but the data was like this: 2 accidental death, electrocution. Okay, 2 sepsis during abortion, sepsis. So, how much is the total maternal death? Basically, they want to test you this concept that electrocution, drowning, these are not maternal death. So you have to remove that. Now count the remaining. 2 plus 2, 4 plus 4, 8 plus 2, 10. So maternal death is 10. Live birth is 4,000. Multiply by 1 lakh. So when you multiply by 1 lakh, these 3030 will cancel out. 10 by 4 will be 2.5 into 100. 2.5 into 100 means 250. Answer will be 250 per lakh. Okay. So basically they're just testing the concept. Electrocution, drowning, not maternal death. HIV patient is also with TB. So in TB, there is a drug rifampicin. Rifampicin is cytochrome enzyme inducer. And because it is inducer of enzyme, it induce metabolism of dolutegravir. So the dose of dolutegravir, we need to add more 50 milligram in the morning. Remember, dolutegravir can also cause neural tube defect. So if a mother is taking dolutegravir, pregnant mother, then they should take high dose of folic acid to prevent neural tube defect. Okay, so that's there. Now, 22-week contraception, how many doctor permission you take? Less than 20 week, one doctor. And less than 21 doctor. 20 to 24 week, two doctor. So correct is two doctor. More than 24 week, panel permission. And in more than 24 week, only congenital anomaly is allowed for abortion. This is written in PARC, so there is no controversy. Congenital anomaly are allowed for abortion. But between 20 to 24 week, on permission of two doctor, we can do abortion of 4 people. Rape, victim, incest. Incest means family member did sex and had pregnancy, so that is there. Then failure of contraception. And of course, the last one which is there is congenital anomaly. So 4 is allowed between 20-24. After 24, only one congenital anomaly are allowed. Blood cholesterol we can measure. Whatever we can measure is continuous or quantitative. If they gave APGAR score or Glasgow coma score, GCS or depression score and all these score and scale are ordinal data. Very commonly asked. So all scale, all score, scale and score, they will come under ordinal data. Okay, all scale and score are ordinal. Now, total number of children, we have done it. Total number they are asking, not girl child, and they are asking per female, not 1000. So answer is TFR. If they add 1000, answer will become GFR, general fertility rate. 36-week pregnant, which is not included in MMR. Truck accident is not included in MMR. That was the part of that question, which is not a part of MR. We have done this group discussion is guided discussion. Denominator in mid-year population is denominator in 2 things, crude death rate and crude birth rate. So answer is crude death rate when we take the denominator as 1st of July. Okay. According to population, which of the following is a ratio? So MMR is a ratio, sex is a ratio. Okay, ratio numerator is not a part of denominator. We have done this part. Sorry for this poor recall options, but I had not given the exam, so it was there. Which is control mosquito larva by Gambusia or Guppy, and there is drug also which you can use, which are Tamifos, abate, and Paris green. 3 drug we can use: Tamifos, abate, and Paris green. So 3 drug we can use, and 2 fish we can use. And in after rainy season, now they will come with this sand-like particle which they will put in the cooler to kill the larva. They have this chemical. One of my friend opened the gate for them with towel. I don't know why they ran away. After that, they did not enter into any room of boy with towel. Anyway, so come here. This is a question on perinatal mortality, which is actually not being asked. But before last exam, it has been asked already 4 times. So in perinatal, we have to count stillbirth, which are 50. So 50 we will write. Plus death in first 7 day. So first 7 day death is also 50. So this is first 7 perinatal. We will divide it by live birth. Total population is 450. Live birth is total population minus stillbirth. So total population is 450 minus stillbirth 50. If you will do, it will come 4000, and we multiply it by 1000. So this 1000, 30 and 30 will cancel. Finally, we have 100 by 4. So 100 by 4 will be 25, which is not in the option. Why it is not in the option? Because the original question has neonatal death 150. It is not 50. In the original question, which came 4 times, neonatal death was not 50, it was 150. So if you make it 150, then 50 plus 150 by 4 you will do, it will come 50. And usually in the exam, when they will give you, simply you can mug up this thing actually, because they do not change the data in this question and ask it already 4 times. Answer is always 50. But here they change the question with data 50, so the correct answer will be 25. Okay. Now we are done with the discussion, but do remember they have asked which of the following is not a direct cause of maternal death. So indirect cause is 3: anemia, malaria, heart disease. Anemia, malaria, heart disease are indirect, rest are direct. And I was telling you how to identify the epidemic. So hepatitis A epidemic they have written, and hepatitis A incubation period is 10 to 50 days. So if all cases are within 50 days, we call it point source. Like here, cases start from 25 of April, end at 21 of May. So cases are occurring in 30 days. Incubation period is 50. So cases are within one incubation period, we will call it point source or common source single exposure. You can see it is written here. Let me elongate it better. It is point source, you can see point source written. Now, if the image is, it became very small. ये मेरे छूने से बड़ा होने की जगह छोटा हो रहा है बेड़ू. ये मेरी उंगली में टच गड़बड़ा गया लग रहा है. यूजुअली मैं छूता हूं तो बड़ा होता है, इस बार गड़बड़ हो गया. I will come back to the image of graph because some teacher has also taught propagated and continuous wrongly. So I want you to teach that graph part and then we will end the session. Rest are some of the slide from which question came, and we have already discussed the important question. This is the image of globe thermometer for radiation temperature, kata for air velocity and cooling power. This is sling, we all can see. These are the type of latrine thing. These are the classification of waste in Park textbook. But let's come to the main thing which I was discussing in disaster cycle. We don't need direct, indirect. We have discussed group discussion. We have discussed. I was telling you that ASA is not 10th pass, 8th pass. Age is 25 to 45 year. Formal education up to 8th class. You can see it's not 10th class. Let me show it here. यार ये फिर छोटा होते जा रहा है, इसको बड़ा करो. हाँ, formal education is up to 8th class, not 10th. Okay, so if someone teach you 10th class, please ask the teacher to correct it. See again in next page, you can again see the same thing. कहाँ गया बे? पूरा ही गायब हो गया. बड़ा हो ना बे? Yes, you can see in this page also they have written that there is one ASA for 1000, one ASA for 1000, not two ASA for 1000, which one teacher wrongly taught. And then what is the minimum education? You can see again, minimum is up to 8th pass, 8th class. So again and again they will give you this thing. Remember 8th class minimum and one ASA per 1000. Okay. Chalo. Now, again, third page also I had given the same thing. This table we have discussed. See, this is continuous. Continuous. They are talking about cholera. Cholera incubation, maximum incubation period is 5 days. And cases start from 28 occurred till 21. So the cases occurred in 30 days. That means cases took more than one incubation period to occur, so it become continuous. Continuous necessarily not need to be fluctuating. But main criteria is that the duration in which all cases occur, the duration should be more than one incubation period. If it is more than one incubation period, that is continuous common source. For example, typhoid Mary, milkman distributing contaminated milk, or contaminated batch of polio vaccine spread in an area, or sex worker transmitting gonorrhea. These all are example of continuous source epidemic. Okay, dear. So I hope you will remember the concept which we discussed. And I know this session went a bit too long, but I'm really thankful for you for being with me till now. And your response was really awesome, very rapid and all. And it was coming even when I was not responding, you were responding very well. So I love you all for your support. Thank you so much. We will meet again in the next session. Till then, Hasta la vista, das vidania. Tomorrow I will have a NEET PG PYQ revision. Bye bye. Thank you so much.